Okay, council members and participants, we are now live.
Thank you. Good morning, everyone. This is the public hearing on the Joint Committee on Public Safety and Public Health and Human Services regarding resolution number 200690. Before we begin, I'd like to recognize Ms. Samantha Williams, who will not read the required announcements. A moment. I understand that state law currently requires that the following announcements be made at the beginning of every remote public hearing as follows. Due to the current public health emergency, city council committees are currently meeting remotely. We are using Microsoft Teams to make these remote hearings possible. Instructions for how the public may view and offer public testimony at public hearings of council committees are included in the public hearing notices that are published in the Daily News, Inquirer, and Legal Intelligentsia prior to the hearings, and can also be found on phlcouncil.com. Everyone who has been invited to the meeting to testify should be aware that this public hearing is being recorded. Because the hearing is public, participants and viewers have no reasonable expectation of privacy. By continuing to be in a meeting, you are consenting to being recorded. Additionally, prior to recognizing members for the questions or comments they have for witnesses, I will note for the record at this time that we will use the chat feature available in Microsoft Teams to allow members to signify that they wish to be recognized. In order to comply with the Sunshine Act, the chat feature must only be used for that purpose. I would like to ask Ms. Williams if she would please now call the roll to take attendance. Members that are in attendance will please indicate that you are present when your name is called. Also, please say a few words when responding so that your image will be displayed on screen as you speak. Ms. Williams?
Councilmember Johnson?
He's present. I think he's having microphone issues. I know he's here.
Oh, we can hear you slightly, Councilmember Johnson. It's just very low. But good morning. Councilmember Thomas?
Good morning, Madam Chair. Good morning, everybody. I'm present.
Morning.
Councilmember Green? Councilmember Gautier?
Good morning, Madam Chair. Good morning, colleagues. Good morning to the public. Happy to be here for this discussion.
Good morning.
Councilmember Gim? Councilmember Brooks?
Good morning, everyone.
Councilmember Heenan?
Good morning, Madam Chair, and good morning, colleagues.
Councilmember O? And Chairwoman Bass.
Thank you. A quorum of the Joint Committee is present, and this hearing is now called to order. Ms. Williams, will you please read the title of the resolution being considered today?
Resolution number 200690, a resolution authorizing the Committees on Public Safety and Public Health and Human Services to conduct joint hearings to examine available options for protecting Philadelphians in the Philadelphia jail system and the Pennsylvania prison system from COVID-19.
Thank you. I would now like to invite the resolution sponsor, Councilmember Johnson, to make opening remarks before we begin hearing testimony.
Thank you, Madam Chair. Madam Chair, can you hear me?
I can hear you now.
Okay, all right. Thank you very much. And first and foremost, I want to thank all of my colleagues for taking time out of their schedule and participating on what I believe is a very, very serious and critical issue. Although we know we're in a holiday season, we're still in the middle of a health pandemic. And so this hearing will allow us to have the opportunity to address and support the issues and concerns of a vulnerable population, and that's those who are housed in our city prison systems. And so we thank all the individuals who are here who are going to be testifying, as well as our commissioner, Blanche Carney for also being here with her team so we can address this issue. Thank you very much, Madam Chair.
Thank you, Councilman. And before we call the first panel, I wanted to just commend you for offering this resolution to have this hearing. This is a very important and very timely topic, as we all know. We have heard recently about, particularly in the Pennsylvania prison system, about people who have had relatives who have been stricken with COVID and who have actually died of COVID, and their family members were never notified or were notified way after the fact. And so we'd like to talk about those issues today and figure out what can we do, number one, to make sure that that's not happening, and particularly make sure it's not happening here in the city of Philadelphia. Some people might say, well, why do we care about people who are incarcerated? Well, they're under they are under our care, which is why we should care. We have an obligation to ensure that all people, no matter where they're housed, where they're where they are in life, that they are actually cared for by the Commonwealth and by the city of Philadelphia. So again, this is a very timely issue, and I thank the sponsor and also my co-chair, Councilman Jones, for your diligence on these issues. And with that being said, Ms. Williams, can you call the first panel? And before you do that, I actually want to recognize the presence of Councilman Green, who has joined us.
Thank you, Madam Chair.
Commissioner Blanche Carney.
Good morning. Good morning, Chair members Jones and Bass, and members of the Committees of Public Safety and Public Health and Human Services. I am Blanche Carney, Commissioner of the Philadelphia Department of Prisons. I'm accompanied by Deputy Commissioners Terrence Clark and Xavier Buford and Chief Medical Officer Bruce Herdman. Thank you for inviting the Department of Prisons to provide testimony for resolution number 200690, which was sponsored by Councilmember Johnson regarding COVID and its impact. The onset of COVID-19 pandemic presented operational challenges to the safety and security of the Philadelphia Department of Prisons, which required a strategy to mitigate the spread of COVID-19 inside our facilities. Safety precautions and protocols were quickly implemented by sheltering in place, suspending civilian visits, and maintaining security, food, medical, behavioral health, social services, and access to chaplains and contact tracing. The PDP works closely with the Philadelphia Department of Public Health while following CDC guidelines for correctional facilities and mitigating COVID-19 inside our facilities. The PDP began manufacturing cloth masks for staff and the inmate population independent of the limited available resources that were fiercely competed for in the open market. Staff were and continue to be assigned levels of personal protective equipment commensurate with their posts. The assignment of our PPE was modeled after the medical model, ensuring staff working with COVID-19 positive inmates were issued the highest level PPE, such as N95 masks, gowns, aprons. And staff assigned to general population quarantine areas are issued appropriate level PPE, KN95, non-surgical, and cloth masks, and all staff having access to gloves. PDP has an ample supply of PPE on hand and continues to issue to staff accordingly. PDP installed plexiglass throughout its facilities on housing unit areas, offices, lobbies, and in official visiting areas. Hand sanitizer dispensers were installed in staff common areas, lobbies, and in official visiting areas. Floor markings and signage were placed throughout the facilities as a visual indicator for staff and inmates to practice social distancing to the extent possible. In-person screening, inclusive of temperature checks and a health screening questionnaire, was established at all facility entrances from the onset of COVID-19 and remain in effect. Anyone presenting symptoms, high temperature, or positively responding to the health screening questionnaire has been sent home to self-quarantine for 14 days and encouraged to test for COVID-19. Anyone reporting exposure to someone who tested positive for COVID-19 was also required to self-quarantine. Moreover, PDP began its contact tracing to mitigate the possible spread of the virus. PDP created educational campaigns regarding COVID-19, mask wearing, and flu immunization that are shown to staff and the inmate population respectively using our closed circuit TV system. Lunch periods are staggered, and roll call for uniformed staff was relocated to allow for social distancing. Enhanced sanitizing protocols remain in place. In the early onset of the COVID-19 pandemic, the PDP transitioned to shelter in place, restricting the movement of the population to mitigate the spread of COVID-19. Inmates are issued multiple cloth masks that must be worn at all times when outside of their cells. New masks are exchanged when they become damaged. The PDP provides soap and cleaning supplies for inmates to maintain their hygiene and to clean their cells and common areas. Inmates were permitted to be outside of their cells for showers and phone calls. In May 2020, PDP conducted a one-time universal testing of inmates, which resulted in an infection rate of 5.8%. Such results inform operations and the ability to transition to the then yellow phase with larger number of inmates permitted outside of their cells for showers, phone calls, and recreation for 45 minutes or longer daily. From the onset of COVID-19, the PDP expanded the intake quarantine period from 5 to 14 days following the CDC guidelines. Symptomatic inmates were immediately isolated and tested, and the respective housing unit was placed in quarantine and the entire unit was tested. Moreover, after transitioning to the then yellow phase to further identify exposure, PDP implemented COVID-19 testing for all newly admitted inmates. The infection rate for 6 months of the pandemic remained below a 5% infection rate. The recent uptick in positive cases in November resulted in a 9% infection rate, and testing continues where clinically indicated. This increase resulted in the PDP transitioning back to shelter in place, with the inmates permitted outside of their cells for showers, audio calls, and virtual calls daily. Also, the PDP had been exploring staff testing as a result of the increase in positive cases and the city's infection rate when on December 18, 2020, received a court order mandating testing for all PDP staff related to the ACLU litigation. It is also important to note outside introduction of COVID-19 can occur through off-site clinic trips, hospitalization, and court-related appointments. If a positive case is identified with staff at one of the criminal justice partner agencies who may have had contact with the inmate population during off-site court proceedings, the PDP safety officer is notified and contact tracing is instituted immediately. Moreover, the PDP has tried to minimize the amount of contact the inmate population is having with others, including working with the courts and other criminal justice agencies to make inmates available for virtual legal visits and virtual court proceedings to the extent possible. We acknowledge that the PDP was challenged with limited internet capability due to the original design of the buildings. However, PDP stood up several workarounds to continue court proceedings such as GAG 9-1 hearings, early bail reviews, and detainer hearings with Montgomery County, and created access to virtual legal visits. In-person legal visits continued during this period, with masks being mandatory for both inmate and the visiting attorney. Seating arranged so that there would be more than 6 feet of social distancing with plexiglass barriers, and the entire room being sanitized after each visit. Given the urgency in ensuring our virtual capability was expanded within a short time frame, the PDP selected the best internet option to create and expand the virtual capability to the courts and for legal visits. Other options, such as independent kiosks, were not selected due to the projected completion slated for mid to late 2021. During the initial height of the pandemic, from March to May 2020, to make sure inmates did not stay in custody longer than they had to, PDP began providing weekly lists of inmates to the courts, district attorneys, and Defenders Association for consideration for early release. And working together with our other partner criminal justice agencies, collectively, this resulted in a decrease of the PDP's population by 21% during that period. The PDP continues to provide the weekly list. Regarding the PDP's virtual capability, PDP has been constantly compared to counties with the total population at or below that of the Coram-Franjo Correctional Facility's population of 2,200 inmates on any given day. There are differences in facility design and space specifically dedicated to ensuring confidentiality for legal visits and court proceedings. Kiosks used in other jurisdictions would have required more extensive infrastructure installation projected into mid to late 2021. And if selected, would have resulted in the PDP not having expanded access for legal visits. Further, issuing an RFP would not have been prudent given the extensive time constraints during the pandemic. In partnership with the First Judicial District, use of the court video portals was made available to the Defenders Association to conduct virtual visits from 2 to 7 p.m. in addition to in-person legal visits with the safety precautions in effect as mentioned above. In support of the virtual visits, PDP stood up an additional laptop via appointment at each facility to increase access to virtual legal visits and extended the hours to 10 p.m. The First Judicial District agreed to extend the use of the portals to 10 p.m. to align with the PDP's extended hours. Additionally, the PDP introduced its virtual tablet platform, making legal and civilian visits available respectively. Tablet legal virtual visits began October 1st, 2020, and civilian virtual visits began December 15, 2020. The PDP has extended Zoom virtual legal visits through March 2021 as we transition to the tablet platform. The platform is designed for 15-minute intervals and requires the inmate to initiate additional calls up to 1 hour for virtual legal visits, with the inmates also having 2 free 15-minute virtual civilian visits per week. The inmates can successfully initiate virtual legal calls without delay. The PDP continues to provide 10 minutes of free phone time daily in addition to the virtual visits. Since the tablet program's inception for virtual legal visits on October the 1st, there have been 1,123 virtual legal visits. Legal visits during the pandemic from April to date were 7,377 for in-person, and August to date, 2,417 have been via Zoom. The PDP does not charge for virtual legal visits as do other counties. The PDP continues to manage the operational challenges driven by COVID-19 using our best efforts to keep staff and inmates safe. We remain fully committed to working with our fellow criminal justice partners to safely effectuate increased legal proceedings to reduce the prison population. Lastly, we will work with the Philadelphia Department of Public Health regarding vaccine distribution. Thank you, and I will be happy to answer any questions.
Thank you for your testimony. We're going to ask to hear from the other 2 panelists who have been called, and we'll take questions at the end. I do also want to recognize the presence of Councilwoman Helen Gim. Okay, and I believe next up is Dr. Farley, our Health Commissioner.
Madam Chair, apologies. The other witnesses on the first panel are merely on call to answer questions.
I see. Okay, well, thank you very much. Okay, so why don't we go directly into questions for Commissioner Carney. I have a question, and in doing some reading and in preparation for this hearing, and also catching up on my reading over the weekend and reading about what was happening in the state system, I have some concern about prisoners who actually have had contact with someone with COVID and now must quarantine for 10 to 14 days. And the idea is that it's at least happening on the state side, is that they are being moved into solitary, which is considered some form of punishment. It's considered a form of reprimand. And so I have great concern about folks who are being moved into solitary, who have done nothing wrong other than being exposed to this virus. So can you talk about that?
Yes, I can, Councilwoman. For 6 months of the pandemic, we were able to mitigate the spread within the facilities. And the reason we were initially in a shelter in place and then transitioned to having the population out of their cells for 3 hours or more was to reduce the transmission. What we're doing now is back in shelter in place again with the same understanding that we have to stop the spread. We do know that folks that test positive or present, they are separated and placed away from the general population. And that is to mitigate. As soon as they're completing that 14-day quarantine period, then they are permitted outside we were working up to 3 hours per day. But right now, with that increased infection in our facilities, it does seem punitive, but it was our only option at that point to stop the spread of the virus. We had realized that we were under 5% for 6 months during the pandemic, but that recent uptick with the Thanksgiving holiday really increased the cases, and it put us in a position where we had to go back to the shelter in place being the most restricted.
Okay, so just sort of cutting to the chase, you are using solitary as a means of distancing and quarantine?
Yes.
Okay. And I want to be on record to say that I find that absolutely unacceptable. Solitary is considered, as I mentioned before, a form of punishment. We all know that there are psychological effects, extreme psychological effects that result from being placed in solitary confinement. And I think that the Department of Prisons really needs to find another way. There's got to be another way. I don't work in the prisons. I understand that you all, like all of us, no one has unlimited space. However, if there needs to be some sort of structure built or, some other way that we can do this, I find the idea that folks are in solitary without having done anything wrong other than being exposed to someone who came down with a virus. This is completely and totally unacceptable, particularly when we know that the prison system is filled with primarily young African-American and Latino men, and women. And so this way of operating, we need to do better. We can do better, and we need to do better, and we need to do it right away. Councilman Johnson?
Thank you, Madam Chair. I appreciate you for giving me the opportunity to ask a few questions. Commissioner, just a couple questions. Can you give us the percentage of inmates who have been infected with COVID-19, staff that have been infected with COVID-19, and has any of these individuals who were infected resulted in the loss of life?
So, Councilman Johnson, unfortunately, we have had one inmate-related death as the result of the virus, which is one too many, and we had one staff-related death, which is one too many. The population that had tested positive had recovered from the virus and was able to recover and be part of that out-of-cell time. I'm also going to have Dr. Bruce Herdman give us the report on our testing numbers. Dr. Herdman?
I'm sorry. This is Bruce Herdman, Chief of Medical Operations for the Philadelphia Department of Prisons. Over the period of so many months, of the total number of inmates, 7% tested positive. Today, that rate is around 5%, a little bit over that. And as the commissioner said, we did have one death of both an employee and an inmate.
Commissioner, in terms of testing, let me go back. Let me just go back for 1 second. Can you clarify those numbers for me? Because I don't think I heard it clearly. Can you say the numbers again one more time?
Yes, sir. The overall infection rate over the length of this pandemic has been 7%.
7%. Is that just for inmates and correctional officers?
No, sir. That's just
inmates.
It's just the inmates. I don't have correctional officer data.
Okay. All right.
And Councilmember Johnson, consistent with the city's approach to the COVID pandemic, we were providing that information to the Department of Public Health. That information was then placed on the city health dashboard and represented as Philadelphians. It was not broken down by department regarding staff infection rates.
So, and I mean, I have to ask this question from a management standpoint. So, so you said it's general information, but it's not information that you would keep as a manager just to keep an eye on what's being done as it relates to COVID-19 and staff that actually work inside the prisons. Is that what you're saying, Commissioner?
No, that's not what I'm saying. We have the information of the staff who have tested positive, where we were able to confirm those tests with the Department of Public Health. The Department of Public Health then in turn puts that information in an aggregate representation for Philadelphians. It's not broken down by department, but certainly we know of the staff who we were able to confirm positive tests. We do have that information, and we had not released that publicly.
Are you allowed to say what's the percentage though? Like 7% percentage of inmates, 25% percentage of staff have COVID-19. You can't say that for the record?
We did not provide that information, but we could certainly get back to you with that information. Now, as part of the ACLU and the recent court order mandating mandatory testing for staff, that information will be released January 25th, 2021.
Okay. And in terms of the mandatory testing, how soon do you expect to complete that testing? And I know you had to do it some time ago in the past in June. How long did that process take as well?
Well, that was for the one-time universal mass testing for the inmate population, Dr. Herdman.
For the inmate population, we expect to be completed in about 10 days. And for the employee population, in probably a little bit over 3 weeks.
Okay. And I want to go back in terms of inmate population. Give me a number besides 7%. Give me what's the actual number?
Councilman, of the 14,518 tests that we performed as of this morning, there were just a little over 1,000 positive individuals over the multi-month period.
Okay. All right, thank you. And also, Commissioner, just to wrap up before on this round of questions, so I allow my colleagues to ask a few questions. So the judge is saying that the judge ordered that inmates be provided 45 minutes per day out of their cells for showering, phone calls, and exercise. What was the policy before that? And I think you touched on it in your testimony. Can you clarify it for the record, please?
Yes, we were well above the 45 minutes out of cell time. We were up to 3 hours per day. And that was based on the clinical indication of the virus remaining at least be at or below 5%. So prior to us going back into this second shelter in place, we had folks out of their cells up to 3 hours per day.
Okay. Thank you very much. I will circle back with additional questions after I allow my colleagues to ask their questions. Thank you, Madam Chair.
Thank you, Councilman. Question, and my colleagues to have questions as well. We'll be hearing from Councilman Heenan, Councilwoman Gim, and Councilwoman Brooks in that order. But I did have one quick question, which was the funding that was supposed to be spent through the CARES Act, the Commonwealth. Up in Harrisburg, they could not figure out how to spend $108 million in funding that was supposed to go for rental relief and some other measures, which, as I understand, is going to the state prison system. Is there money that will be coming to Philadelphia's prison system as well? And will that help address some of the issues in terms of housing and moving inmates so that you do not have to use solitary as a means of separating or social distancing folks?
So we have 2 inmates per cell. So they're celled together. We have taken advantage of some of that CARES Act money with the screeners, providing additional staff supports for services on the housing units, and we're submitting some additional requests to access the CARES funding.
Okay. All right. Councilman Heenan?
Thank you, Madam Chair, and good morning, Commissioner. Thank you for your service. I have 3 quick questions for the commissioner and 1 for the health department. Let me start off by saying, what's the plan to ensure that all individuals in PDP custody have access to the COVID-19 vaccine? And are they connected with the community health resources to obtain a second dose of the vaccine once they were released? Because, you're getting 2 doses and being able to track them might be a little bit difficult. Is there a plan for that?
Yes, there is a plan. We're working with the Philadelphia Department of Public Health regarding the vaccine distribution. Of course, they would have that information for folks that would be vaccinated inside, and they would have to have some follow-up mechanism post-release. So we're working with them to see how we will effectuate the vaccine distribution behind the walls, and then their plan would be how they're going to follow up with these individuals post-release. And I believe they can provide additional context regarding the plan post-release.
I'm going to ask that question to the health department when I finish a few other questions real quick with you, because I think that's important. There's a finite amount of time, right, that we have for the second dose, and there's not much wiggle room, when it comes to having, 2-day leeway on being vaccinated. So it could potentially put the public at risk when it comes to, the spread of COVID-19 and or the efficacy of the actual vaccine. So if, I just like to make sure that we do have a plan for that, and that the health department is going to be diligent about making sure that somebody gets the follow-up vaccine upon release. Another question is for the PDP staff. You were just talking about the COVID-19 testing. How often and regular are staff employees being tested?
Prior to the court agreement, we were working on a plan when we were monitoring the infection rate and if there would be any increase. With this recent court order, we do have a plan that we would work to test the entire staff complement through January. So we have a plan in place to effectuate that order. Okay. And prior to that, Council Member Heenan, staff who reported a positive test, we were able to confirm that if it was facilitated in the city of Philadelphia, we were able to confirm that they were tested through the city's health department. But now we will test the entire workforce assigned to PDP.
Okay, well, that's good to hear. So is the health department testing the employees, and are you contact tracing those as they test positive?
Yes, anyone who self-reported exposure or a positive test, we did conduct contact tracing through the PDP safety officer. The health department will not be administering the testing for staff. We will use our contracted health provider to do so on site.
Okay, and as per the department's press release on 11/24, family and friend virtual visitations began on December 15th. According to the same press release, incarcerated people must pay to access more than 2 15-minute visits per week. Is that accurate?
That is accurate. So we're providing, we continue to provide the 10 minutes free regular phone time. And we also provide 2 15-minute free virtual visits during per week. And family and friends can purchase additional time. The reason is we want to make sure that all inmates, regardless of their funds to access those type of virtual visits, have access to it. And given the size of our population of 4,300 plus, we want to make sure that we're able to offer those free visits to everyone. Certainly family and friends. What did you say, Councilman Heenan?
They started the visits?
Yes, they have started. And this is consistent with what we had in place prior to the virtual visit expansion where family members were purchasing and the inmates were purchasing additional phone time above the free minutes that we were providing. So it has aligned with our existing process to offer phone and now virtual visits. So it's not a change. They've been purchasing additional time.
Okay, well, that's great. And last, what is the rationale behind charging to see their loved ones during the pandemic?
Well, the rationale is we're offering the 2 free visits that we believe that we wanted to do that for them. But the same is there's a cost to it. We are exploring an opportunity if we were to eliminate that, but this is less than what they would have been paying should they take Incepta or Uber to have in-person visits.
Okay, thank you, Commissioner. Madam Chair, I just have a follow-up question with the Health Department on the vaccine.
Certainly.
If I can, if somebody
Absolutely.
if somebody is on the Health Department is here.
Dana Perella from the Philadelphia Department of Public Health Division of Disease Control is present.
Okay, Dana, so to follow up, we understand that the vaccine is likely to be administered to those incarcerated in our prison system. Do we know, and do you have a plan on how to follow up on the second dose for those who are being released that are incarcerated presently?
So doses given will be tracked in our information or immunization information system. It's a pretty robust tracking system, so we'll be documenting doses given and be able to identify who needs a second dose. As for logistics for getting someone their second dose, we're still learning more about the process, particularly how community pharmacies such as CVS and Walgreens that have partnered with the vaccine distribution process will be involved. And I imagine our vaccine group will also be having community clinics. So I think as we go through the different priority groups, the resources and availability for getting the second dose, it'll become more clear, and there will be several options, just as there are many options to get a flu shot each year.
And I appreciate that, and I understand that there may be and there will be many options. My concern is notifications are only good as the information that's provided, and somebody, somebody that is being released having only one of a 2-part vaccination shot. If we don't have the correct information, I just want to make sure that we are vetting the information that we have with the Department of Prisons and the Health Department on an individual that's being released, because they may not be as easily tracked as others in other groups. So I think it's kind of it's going to be a little more difficult and trickier. So I hope we pay attention a lot more to making sure that we have the proper notification with the right contact information in one form or another. They may not have cell phones. They may not have a place to live. They may be going into some of our cognitive care places, which is extreme high risk, and or shelters, right, and or transition places. So potentially we have a challenge there. So I just like to make sure that we focus in on the second follow-up shot to the vaccine as it gets distributed. That's all I have, Madam Chair.
Thank you very much. Councilwoman Gim.
Yes, thank you very much, Madam Chair. My apologies.
You're welcome.
So I wanted us to, first of all, thank you very much, Commissioner Carney, for coming before us. I know these are very difficult times, and we have been here before. Last spring, we had a pretty intensive conversation with you, driven largely by concerns that have been brought forward to many of us on City Council by members of your staff, the union in particular, and I think one of the things that I want to talk about is I want to just sort of separate the conversation about our correction officers who are city workers. They are our employees, ones that we care about deeply, their health, their safety, and their sense of value is deeply important right now as we try to navigate the devastating impact of COVID in our prison population in particular. And I just specifically want to take a minute to talk about the importance of caring for our corrections officers. In the previous hearing, certainly that we had last spring, we really tried to underscore the importance of safety and testing measures. And I'll just be honest, I'm really distressed that one, we're not even tracking the testing rates, or that we wouldn't even be able to explain what the COVID positivity rates would be of our own staff. I know that anybody in my office who was sick or anything like that, I would be paying attention to them every single minute. We really have to emphasize how much public servants are putting themselves on the line to make sure that this city is functioning, that it runs. And I just need to say that I'm distressed that we don't have those numbers in front of us. It feels like, if we care, we should know, even though those numbers are hard to face, so that we can figure out a plan. And so I don't know what to say, but I find it just hard to understand why we wouldn't have the COVID positivity rate of our own corrections officers.
Councilwoman Kim, thank you so much. We do have that information. I just wanted to reiterate that based on how we were reporting that for city workers, that information was not a separate reporting mechanism. So we do have a reporting mechanism that we track in the daily application for all staff who have either tested positive or taken some form of COVID related approved leave, such as the EPSL, self-quarantine. We have that information. We just have not submitted that information and released it publicly. So it's not that we don't know, and I'm going back to Councilman Johnson's question. We were submitting that to the Department of Public Health for their aggregate data dashboard. We have that. We have a platform in place. We know the numbers of staff who have been out on COVID-related leave and of those who have tested positive. So the workforce is important to us. We do have that information. We simply just did not release it publicly. The reason why we had not released that publicly was because we have been challenged, as other departments have been challenged with the COVID-19 pandemic. Being a public safety department, we did not release that information because we did not want to announce to the public or the inmate population the challenges that we faced with the COVID-19 regarding the ability to provide coverage. So there was a reason behind that. Staff are very important to us, and we're tracking that. We work with staff. They have taken the available leave that is allotted. And even some staff we've extended their leave for various reasons on a case-by-case basis for extended personal leave of absences. So I want to assure you that we do have that information. It just has not been released publicly for that reason.
Right. And I think one of the issues that I have with this is that, I went on the dashboard. It does not say anything like, I'll ask the Department of Health later, whether they're going to plan to release it. But it sounds like you have no plan to release it, in part because it sounds like it's very serious. And so, and this is not to say that we blame you for the seriousness of what's happening to our own staff and our own people. I absolutely don't want that to be the case. But I think what's distressing is that it is, we had our hearing with you in the spring. Testing and safety of corrections officers was at the top of our conversation in the spring. It is now December, and as Councilman Heenan kind of, had you share out, like, we're only now talking about testing everybody on the staff, and that may not roll out until January. It's underway perhaps, but it's what I'm saying is that if I felt like if you're tracking the data and if you are not releasing the data, I assume because it's terrible, I want to know that in between we had an aggressive plan on testing, that there were lots of conversations with corrections officers, union representatives, and others to demonstrate significant things that have evolved since our spring discussion and our hearing to the end of December, where, individuals in our prisons, like as many as 1 in 5 or some, other numbers that are devastating are really impacting things. And I guess I would like to hear from you what additional measures you feel that you've put in place and what kinds of conversations specifically you've had with corrections officers and the union to ensure the safety and health of our staff.
Thank you, Councilman Woman Gim. So what we plan to release, testing will be effectuated starting December, and we're slated to complete January 2021. At that time, we will report out of the confirmed positive cases we had received from April through the point in which we start the one-time mass testing for all staff. Those numbers aren't as high as you think, considering our workforce. So we will make sure that we carve that out so you'll have that information. And then we'll release the one-time testing rates for the staff once we do the one-time universal testing. We're also looking at carving out of those 2 data points so that if someone has had the virus, they're testing positive, we're going to now align that with the number that we receive daily of those confirmed cases. We've been meeting with the union virtually bi-weekly and discussing a variety of protective factors that we have in place for staff. A majority of our COVID-related leave for those that we did not have a confirmed test. These were just staff reporting possible exposure. We'll be able to carve out that number as well. So we haven't confirmed that they had a test because testing had not been mandated. This was just a simple self-report, and we gave people that time. If it was related to healthcare, they were given that time. But because it was not mandated, we are only able to report the confirmed cases that we were able to confirm through the health department. So it wasn't mandated. We don't know who those staff were. They were simply reporting, I believe I was exposed. We wanted to make sure we kept the workforce safe and said, okay, the moment you're reporting exposure, you must quarantine for 14 days. And so that they're calculated in the leave rates as well. And we'll provide that information inclusive of the universal one-time staff testing in January 2021.
Yeah. Well, look, I'll say this, mandatory reporting is one thing. Mandatory testing is another. You know what you test. You don't, I think it's clear this has been something that's been requested, and that your division in particular is one that we are talking about from a sense of caring. We want to emphasize that this is something that we care deeply about. And I do think that mandatory testing is very important at this stage, just because of how many people are engaged. And it's hard for me, again, I want to underscore that we're going to be supportive around this and would like to see that be a continued priority. You don't need to pander to me or anybody else. It's really about looking out for the safety of individuals. Very quickly, in March, when the COVID crisis began in Philadelphia, it's my understanding there were about 13 children under the age of 18 who are held pre-trial in the adult jails. As of last Friday, my understanding is that number is around 30. If that's true, are these young people also subjected to solitary if they are testing positive at all, or could you speak to that?
So when we talk about solitary is a single cell. We have 2 individuals in each cell. Because we, as of today, have 31 individuals, there are fewer of them, so they can be housed in a single cell.
So that is solitary. These are the young people, right? So when you say that, housed in
So
a...
there's an opportunity that they can either be housed in a separate cell or housed together. Right now, they're on at the Riverside Correctional Facility, and they're not in solitary. It's so few of them, so they're coming out. And so when we talk about solitary, that would be those folks where they're the only ones in that cell. I know there's the definition of the time being in the cell, so I understand. And we're working to see what the results will be. We don't want to just have everyone out because what potentially can happen is if you have healthy individuals and you allow people to commingle just by bringing them out prior to getting test results, you're going to increase your infection rate. Mm-hmm. And that's what we're trying to avoid. We understand that this pandemic has taken a lot out of everyone. There are concerns from the inmates, their families, their loved ones, and staff. But we want to be thoughtful and strategic in how we respond and not react. This is not the best scenario. We function not in shelter in place for 6 months. And that strategy early on allowed us to get to 3 hours, up to 3 hours or more out of cell time. Mm-hmm. What I want to impress upon the audience is that you potentially have healthy individuals, right? But if you start to allow people out without the proper testing and allowing time for those test results, you're going to impact and infect other people that normally would not have been infected had we maintained the strategy. It took us 10 days to effectuate the one-time universal testing for the inmate population, and we're doing that now. So that will give us additional time period for us to say who's positive, who's not, and then allow folks to return to being out of their cells for 45 minutes or more.
So, Commissioner, just, in the interest of time, could you just clarify? So there are 31 young people under the age of 18 who are held pretrial in the city adult jails. Is that accurate?
That's accurate.
Okay, and what's the youngest age?
I would have to confirm that information. I can get that back to you.
Okay. And then I'll just end here. Councilman Heenan touched on this a little bit, but, in a very uncertain time, especially when so many people are sick, I think the rationale is not about asking families to pay for access to their individuals. One of the things that we would hope that technology could bring is some democratization and some reduction of financial burdens that are put on families and communities that would otherwise have to travel, take SEPTA, endanger themselves in in-person visit. And so I think the message is not, we appreciate the fact that you're thinking about offering everybody a 15-minute visit a week. But, we've got 31 young people in there who are under the age of 18. It is unhealthy to have their families have to pay. And I think it's unhealthy for anybody, and so I think the message that's being sent is not that, they would have to pay otherwise, but look, virtual world should allow for some democratization and reductions of burdens on people where this would otherwise be impossible for us to do. But in fact, virtual technology should allow us more access to give to more people. And so I would encourage that we don't think about virtual visits being by pay, and that we expand those, and that young people, especially because we've got 31 young people under the age of 18 in adult jails, they have to have regular access to their families. 2 virtual visits, 15 minutes each, is simply not sufficient for anybody, but especially not for a young person. And I'll underscore that, and we'll be happy to follow up. But thank you very much, Madam Chair.
Thank you, Councilwoman. And thank you for your questions. I just want to urge the Commissioner, and I know that there's a strategic reason as to why numbers aren't released, but at the same time, because these are taxpayer dollars that fund everything that we do, I do have to advocate and say that, sometimes we have to do the uncomfortable and release things that we might not want to release. But it's important that people have some sort of a sense of what's going on, because the number is what the number is. I think that having a better sense on in terms of what's happening within the prison system requires information. And so as much information as we can provide, I think we should. So I just wanted to be on record for that. Councilwoman Brooks.
Thank you so much, Madam Chair. Good to see you, Commissioner. I have a few follow-up questions, and then I'll have my own. One of them is to Councilmember Bass's questions around solitary. I have some concerns, like for folks who have pre-existing conditions. I had a phone call to my personal phone yesterday in reference to someone who was already having a pre-existing condition and was put in solitary, and they didn't feel like their health needs were being met. And I wanted to figure out, is that something that's actually happening, and is it being tracked? So if someone already has pre-existing and test positive, when they're put in confinement, are their health issues being met in a way to suit both their pre-existing conditions and their exposure to COVID?
Yes. So if I could circle back for one thing regarding the phone calls, I will be looking to council support. As I said, we were exploring the possibility of offering those free calls. So I would really look for council support for funding for the city's budget to cover those calls once we're complete with exploring offering the free calls to the population. To your question, Ms. Brooks, healthcare is not interrupted. So someone with a pre-existing condition continues to receive treatment, and we also continue to send inmates off-site when we cannot treat here on campus. So the healthcare is still available. It's 24 hours a day. And if we're seeing that we can't provide that care, we still transport people to the local hospitals or the provider, the specialty provider, if they're accepting patients to continue rendering care.
Do you know how long it takes for that process to take? So if someone is in solitary, they're experiencing conditions related to COVID and their pre-existing conditions, how long does it take before that decision is made to send them somewhere else?
Well, it depends on the medical doctor or treating physician who's seeing them. If they are in isolation because they're positive for COVID-19, they're getting engagement daily. And so they have the opportunity to speak with the medical provider, and they're assessed, and based on the doctor's clinical assessment, they would be sent off site to the hospital. If there's a specialty doctor, we're at the doctor's mercy depending on their schedule. So there are several variables that have to be assessed, but we haven't stopped off-site clinic or hospital trips.
Okay. If I get more information, I'll reach out more about this specific case.
Okay.
And my next question is related to Councilmember Heenan and Gim's questions about virtual visit. Exactly how much the additional cost? I'm just concerned because I'm thinking in Councilmember Gim's about families like young children, when we have people that are already struggling to buy groceries. You know, whether it's less than the cost of SEPTA when people don't even have money to get on SEPTA right now, it's still very alarming. So exactly how much is that cost?
So phone calls are 17 cents. That has not changed. And virtual with the new expansion is 25 cents per minute.
Okay. And I'll figure that math out later. And my next follow-up question was related to the numbers with contact tracing and the numbers of correctional officers or staff that have been tested. Has that information, I know you had concerned about sharing it publicly, but has that information been shared, whether it's reported, confirmed, or just testing, been shared with the union? Because if the concern is to look after the membership, in your case, your employees, if the union has that information, they can also help support in making sure that, follow through is being made. So I'm not really, I understand why you wouldn't want to release it public maybe, but why hasn't it been shared with at least the union so they can be a part of the process to help protect the safety of workers?
Councilwoman Brooks, the numbers are shared with the union on our bi-weekly phone calls.
So the numbers are tested and confirmed?
Confirmed.
And reported?
Confirmed, yes. Confirmed positive cases. Those numbers have been reported from the onset of COVID-19. So we've shared that information. We just had a conversation, our last call was last Thursday, and we reported the number of confirmed cases. And that's been ongoing throughout the pandemic.
Okay. Thank you for that. My other question is about the maximum number of people being held in a facility. I know it changed at the beginning of COVID in order to comply with social distancing requirements. Is there a new maximum population that's being practiced while we're doing this social distancing measures in this second round of COVID-19?
Well, we're not triple selling anyone. So what we're doing is we're housing the population to a cell. And so it's based on the capacity, and that leads us into, we're looking at the available bed space that we have, and we're making sure that we utilize it wisely. And we were working on the cohort model prior to this second uptick in COVID-19. Individuals remained on their housing units to a cell. They were allowed out up to 3 hours, and that gave us the ability to manage the population. As the numbers continue to increase, we're utilizing the available bed space that we have, but we're not triple selling anyone.
But is there a maximum number of folks allowed in each facility?
Yes, every facility has their own maximum number. There's a facility number for each facility, and we haven't exceeded that across our facilities yet.
And this facility number, is it the one that you created post-COVID, or is it just the general?
No, this is the facility design number. Facility has a bed capacity. Each facility has a bed capacity from the original design with some flexible bed spaces. We have not been utilizing the flexible bed spaces at this time. We're using 2 per cell, and each facility has been housing inmates appropriately.
I understand it, but I think my question is, when we think about maximum capacity or facility requirements, have those been changed in reference to COVID to ensure social distancing? So I'm gonna use it to restaurants. So we went through a restaurant shift. So 25% or 50% are those type of plans being implemented for facilities for the prisons?
Where we can, we have done that, but it's not across the campus, because again, we have 4,358 folks in custody. Where we're able to reduce and spread people out, we have done that. But again, you're challenged with the commingling of custody levels and different classification levels. So you can't just commingle people and spread them out. There's a process to how we assign people and reduce populations in the facility. It has to be done safely and via classification process.
Okay. I have a follow-up question for Councilmember Johnson's questions about out-of-cell time. Just to clarify, what was the out-of-cell policy during the second most recent shelter in place? And you mentioned it was up to 3 hours before the shelter in place, but what was the policy for shelter in place when it was instituted?
So it's the same policy we have now. It was the most restrictive to mitigate. So folks were allowed out of their cells for phone calls and showers daily. When we were, after we received the universal testing results, we then were able to transition to the then yellow phase, which allowed us to get up to 3 hours. And that was for phone calls, showers, and recreation daily.
Okay. And also, we know, like last week, the federal court ordered the Department of Prisons ensure that everyone who's incarcerated gets 45 minutes of out-of-cell time. Are you planning to comply with that order, and what changes will you need to make ensure that these folks receive their 15 minutes, especially as we talk about, spacing and some of the things you said? I was just wondering, what does that look like in real time?
That would look like, instead of having 1 cell at a time, you would look to have 4 to 5 cells out at a time, and those folks would commingle.
For the full 45 minutes?
Yes. And that's with them awaiting test results. So if they weren't positive at the beginning, with the 4 to 5 cells out together for 45 minutes, it could possibly spread the virus, which is something we were trying to avoid, to give us the time to do the second round of universal testing of the population, identify who's positive, who isn't, isolate those folks who are testing positive, and the folks who are not, then they would remain in quarantine. Since November the 15th, we started testing every 7 days. So if there was an individual who was positive on a housing unit, we then placed that entire housing unit in quarantine. The positive inmate was then placed in isolation for the 14-day quarantine period. That housing unit was tested every 7 days until we come back with everyone on that housing unit being negative. Once they test, that's every 7 days, being tested until the entire unit comes back negative. When that happens, then that unit is brought off of quarantine, and then they resume up to 3 hours a day out of their cell.
And my last question, I know you said you'll be reaching out to council about funding around these virtual calls, but one of my colleagues just put the math in for the cost of the call. So $4 for every 15 minutes and $15 per hour for virtual is pretty expensive for a lot of these families. And I think that whatever we can do to ensure that especially young people aren't separated from their families during this time, regardless of what they've done. I mean, I think it definitely affects the mental well-being of not just young people, but all people, that we have to do something about this $15 per hour virtual, because keep in mind, we're talking about folks whose families members don't even make $15 an hour. So, you know, for us to be like, oh, it's not that much, that can be very costly to some of our residents here in the city trying to stay in touch with their loved ones. And keep in mind, these are the same loved ones that are reporting information for us to be able to have these calls with you to know what's going on. So we need to make sure that we aren't blocking families' rights to be able to be engaged in the process with their loved ones. So I look forward to more conversation around the charging for visits, virtual and the phone calls. Thank you so much, Commissioner.
Thank you.
Any other questions from members of the committee? I have a question, Commissioner. Can you give us an overview of the amount of PPE equipment that's allotted to staff and inmates, and then also how do you deal with mitigation in your operations outside the prison, specifically in your trailers?
So for the, we have 12,000 cloth masks on hand. We've been manufacturing them. They're available to the staff and the inmates. We also have PPE on hand, and I'll have my deputy commissioner provide an update with those numbers. Procurement has, the procurement department has engaged in several contract vendors that are slated to come aboard in January, and we will access those contracts to secure additional PPE as well. So Deputy Commissioner Buford?
Yes, Commissioner. For the PPE that we have on hand, we have 727 boxes of nitrile gloves, ranging from small to XX. We have 971 hazmat suits. We have 510 N95 masks. We have 1,858 of the plain dust mask. And then we have 5,470 of the KN95 mask. We still have orders that we are waiting to come into the warehouse. So as of right now, we have an ample supply of PPE on hand.
Is it mandatory for all inmates and staff to wear their mask?
Yes, it is. They're to wear their mask at all times. That's our best transmission. Yes, there are, we're repeatedly and constantly reminding the inmate population to do so. If there's any staff, we've reminded them as well. We have signage throughout the buildings. We have the the video campaigns. And as I stated, we have plexiglass installed throughout the facilities. So it is mandatory whenever they're out.
And give me an overview of your operations for mitigations among staff outside the prisons.
We can't control what staff do outside the prisons. We encourage staff from the lens of you have to take care of your families. We've been putting that messaging.
In the context of your prison operations and your trailer units, how does that operate?
So the trailers, we do have some trailers that have cubicles. They've been spaced out. We also have the sanitation protocols the same way for the facilities. They get the staff assigned to those trailers also go through thermal screenings and the questionnaire.
And in terms of hand sanitizer, I saw you mention that inside your testimony. Who gets distributed hand sanitizers and where?
So hand sanitizer dispensers have been installed throughout the facilities, and staff have been approved to bring a personal size bottle hand sanitizer inside the facilities.
Okay, thank you very much. Councilman Allen Dom.
Thank you, Councilmember Johnson, and thanks for bringing this issue forward. And thank you to Councilmember Bass for chairing this committee. And good morning, Commissioner Carney.
Good morning.
I wanted to just make sure I can understand the charging of for virtual visits. Is that done for exactly what is the reason why that's done?
The charging has been the revenue that we receive from those calls or visits is reinvested back to the prisons outside of the general operating budget. So we have the inmate welfare fund, and that revenue is then given to support other contracts for inmate programs and services pre and post release. So we have several contracts funded through the Inmate Welfare Fund, which is not on the operating budget, that provide housing for women upon release, some treatment follow-up, and we also have vocational training programs and reentry programs funded out of that same fund. So that's the rationale. So if we were able to get that money allocated to the operating budget, then that would help us to transition away from cost, charging for the virtual.
How much did we generate a month in this category?
For this category, the initial round had been for the cost to families was initially $5,000.
So we're charging $5,000 a month.
No, we're not charging. That was the revenue of purchase for the additional time.
I understand. So let me rephrase it. We're generating $5,000 a month from people up on State Road in prison for them to speak to their families. It's $5,000 a month.
That was $5,000 for the monies that the families purchased, that additional time, and then that money goes to fund the other contracted programs not covered on the operating budget.
I mean, it seems like a small amount of money generated for that kind of a limitation for those people up on State Road. I would say this to you: I'd be happy to donate $10,000 of my own money for you not to charge for the next 2 months. What do you think about it? And let me know.
If I can clear it through ethics, I'll take it.
Okay, then I don't want them charged though for the next 60 days. Let's figure out another way to do this.
So we could suspend that and monitor it for a population of 4,358. Right. All right, we'll work with my team.
It's my Christmas gift.
Thank you, Councilman Dunn.
All right, thank you. See you. Thanks very much. Thank you, Councilmember Johnson.
Thank you, Councilman Dunn. Councilman Derek Green.
Thank you, Councilmember Johnson, for having this hearing and having this conversation. Just want to follow up on some of the points raised by Councilmember Johnson. I'm not sure if I heard. What's the actual cost for the prisons in order to provide the phone service? What's the cost per call?
It's 25 cents per call.
No, that's my understanding. That's the fee you're charging. But what's the cost to the prisons per call?
We would have to give you the breakdown. It's an intricate breakdown because that was contracted as an additional cost to this contract. I can get that information back to you, Councilman Green.
Okay. Well, let me ask this question. Does the prisons department break even on this service, or do they make income?
We did generate some revenue on it. It's been drastically decreased. So right now, our guaranteed amount on this would be roughly $60,000. Prior to the installation, the guaranteed maximum was roughly around $90,000. So we reinvested that to get this platform up and running.
Again, so that was the information that Councilman Don was talking about. So you have a guaranteed income of $60,000 on this initiative that you're making money and providing access for people to contact their families.
Yes. And so again, and thank you for your question, as I understood it differently from Councilman Dom, that information, that funding is reinvested into the inmate welfare fund to fund other programs. If I can present during our upcoming budget ask that, okay, if we're going to eliminate, that we have some support to add that funding into the operating budget.
So let me follow up. So that $60,000 of income, that's reinvested for services on behalf of inmates?
Yes, it is.
Okay.
Mm-hmm.
Okay, and what are those services again?
So those services are our Orchard Project that's located behind PICC, the Pennsylvania Horticultural Society. You have the Why Not Prosper program. You have the Temple Orchard program. You have New Leash on Life and some other ancillary programs that come under that. The Inmate Welfare Fund also funds our chaplains that are not on the operating budget. And we do some other inmate incentive services or rewards for the population. So that money is used strictly to reinvest and provide services to the inmate population.
Are there other services that are charged to inmates where an income comes into the prisons department, and how is that income used?
So again, it's reinvested for any programs not covered on the operating budget under the Inmate Welfare Fund. So we have fines and fees. We've eliminated a few of those fines and fees. So we had already started working on the elimination. A few of those were for, of course, when we suspended in-person visits, we were charging $3 for pictures. We eliminated that as well. We thought we would go back to in-person, and we decided, based on the severity of the pandemic, knowing to stand up the virtual visits. So we're working through the fines and fees for the population and how we can eliminate additional fees.
So any type of service or any type of product or service that inmates are being charged for outside of any operating costs, those dollars are reinvested for and on behalf of the inmates, or do any of those dollars go into the department's general fund?
None of those dollars go into the general fund. They're specifically for the Inmate Welfare Fund, for the express interest of the inmates.
Okay. Thank you, Commissioner Carney. Thank you, Mr. Chair.
Thank you, Councilman Green. Any other questions and comments from members of the committee? Thank you, Commissioner. Will the clerk please call the next panel?
Larry Krasner and Kier Bradford Gray.
Ms. Bradford, you can state your name for the record and please begin your testimony. Ms. Bradford, please state your name for the record and begin your testimony.
I think she's frozen.
I think, yeah, she's having some technical difficulties. And so at this time, I'm going to ask for Liam Rowley and Mike Lee, whichever you are going to take the lead on behalf of Commissioner Krasner.
Sure. Good morning, Councilmember Johnson and Chairperson Bass. Thank you very much for inviting the District Attorney's Office to testify today on Resolution 200690. Again, my name is Mike Lee. I'm the Director of Government Affairs and Supervisor of Adult Diversion. It's my pleasure to be joined today with ADA Liam Riley, who is the supervisor of our pretrial unit, and we'll walk you through many of the specifics of what we've done at the District Attorney's Office to try to mitigate the potential for hotspots and outbreaks within both our jails and prisons. Since COVID-19 first emerged last December, halfway across the world, our office began making plans to figure out what steps we could do locally to keep prison populations down, whether that included trying to slow the number of people coming in by adjusting our bail requests, and as well as what we can do to help get people out, which is where Liam definitely excelled and exceeded all of our expectations. As the COVID-19 outbreak got closer and closer to Philadelphia, our fears were coming true. We saw hotspots emerge in places like Cook County correctional facilities, New York City jails, and even locally in Montgomery County. We're very thankful for City Council for granting our transfer ordinance and for working with us, as well as the other criminal justice stakeholders, to really take the lead and mitigate early in the spring and throughout the summer with COVID-19 and incarcerated people, as well as the staff and the families and communities of both groups. We are continuing to work with our joint partners, and I will let Liam talk about that a lot more specifically. But the last thing I'll just say before turning it over to him is that we are working 7 days a week, 24 hours a day, trying to update and provide information to victims and witnesses whose cases and trials have been delayed. We're reviewing cases for offers earlier and earlier in the criminal justice process. We're reviewing bench warrants, both via closed circuit TV as well as administratively. We're also working very hard to address detainers, which is one of the drivers of local incarceration. I'll let Liam go into specifics. The DA apologizes he can't join you this week as he has last week and a few weeks in the past, but we will be happy to answer whatever questions we can, and any questions we can't, we'll be sure to respond in writing. Thank you.
And good morning, members of council. As Mr. Lee indicated, my name is Liam Riley. I'm the supervisor of the pretrial unit at the Philadelphia District Attorney's Office, and many of the efforts to control the population of the jail falls within the pretrial unit, which is why I took the lead on many of these initiatives. Our efforts started in a major part the week prior to the court closure in March. What we did first was identify people who are at risk, either due to health conditions or age, and proactively reviewed them to see if there was any good candidates for release. Once we identified someone, we would inform the defense attorney, usually in that case, the public defender's office, and we would contact the judge with them to secure release. We also started to identify people who were serving county sentences, so sentences of less than 24 months, who were on state road. We started looking at people who were eligible for parole within the next upcoming months, and we also went backwards and looked at people who had been denied parole for whatever reason in the months prior to that. That specific initiative is one of the places where the jail population lowered the most, and that reduction has been sustained now over time. As the court closed on March 16th, we moved to a process of having written motions for release of individuals. Some of our review, as I said, in the case of people who were at risk, were proactive, and some was based on referrals from the defense. In those first few weeks, it was a bit chaotic because the courts were closed and there was no central process in order to effectuate someone's release. There was a time period where we were actually ready to go drive to a judge's house in Northeast Philadelphia in order to get orders signed. Over the days, however, the court began to staff its motions unit. The clerks there were able to process orders via judges via email. And over the next few weeks, a more formalized written process for filing bail and detainer motions and parole motions took place. However, that was not enough to drastically change the jail population. And so we advocated for a more centralized system of hearings where judges would be in courtrooms with court staff where the defendant's presence would be waived and we could expedite a number of releases with these mass review hearings. Those hearings took place mostly in April and through May of this year. Some days we had 7 judges sitting in courtrooms. These are common pleas judges reviewing lists of sometimes 30 to 40 individuals per day. And this resulted in a pretty significant reduction in the jail population over the course of that month. The population was reduced every day. The daily population was reduced by a total of over 1,000 people. That process continued through the court closure up until the beginning of June. In addition to those common pleas courtrooms, municipal court operated an emergency written bail motion process, which is still in effect today. And we had the ability to list by agreement any case that we thought could be resolved in a particular municipal courtroom. This population reduction was made possible by basically our ability to really analyze cases thoroughly. There was no across-the-board categories of cases that we would object to or agree to release. We looked at each case individually, and the main question we asked ourselves in every case was, is this person that we're considering or agreeing to release for a threat to public safety? And if they were not, our default was to wherever possible agree to release. Our release options were limited at that point because no new house arrest was being set up. People could not report in person to post-trial or pre-trial supervision. And so it was a pretty stark decision we had to make. Either this person is released or the person is held. We also had to consider the input of victims, which was central to our review process. We had staff working, as Mike said, around the clock, 7 days a week and weekends to contact victims and sometimes do that very speedily so we could have answers to report in court as to what a victim wanted and whether or not a victim felt safe with the defendant's release. There was also a few other areas that we had to identify. Rather than releasing somebody to a specific program at this address, judges are people more general orders so that wherever a program is found, the person will be released to. Yes.
Just give us a second. We were just informed that we have some technical difficulties, and so in order for us to do things in transparency and decency, I guess we have to hold up for a second for them to address their technical difficulties because we aren't live streaming at the moment, okay?
Thank you.
Just give me a second.
Modesto, will you just inform everyone once we are back live again? Thank you.
Yes, I will, Brett. Thank you. Councilman, you may resume. We are now live again. Thank you.
Councilman, can I continue?
Modesto, we're live now?
Yes, we are, Councilman.
All right, thank you very much. Mr. Riley, please continue.
Yes, thank you, Councilman. So with respect to the treatment programs, they are, the defense has been able to find, in many cases, alternate programs once they hear that another program is not accepting people. But also the court has been able to sign orders that are more general. So a person is not slated only to go to a specific program. Instead, it's a release that allows them to go to any program that the defense finds. Certainly, knowing the difficulty of finding alternate programming and housing for people, that's something we've had to confront in making our release determinations. And wherever possible, we are agreeing to release with either a drug evaluation to be set up from home at a future date or without that condition at all. With respect to your first question, Councilman, about CJAB, there are regular meetings of various subcommittees within the system throughout the week to deal with many different issues, whether it's discussing the ability of lawyers and defenders to contact their clients at the jails. That's a subject of many of the phone calls that we've been on. Whether it's the ability to create an expedited process for resolution of cases once an offer is accepted. So there are numerous different committees that are talking throughout the week. Usually it's the defenders, the district attorney's office, the prisons, and the courts that are involved in those talks.
Yeah, can you let me hear what they're saying?
Raleigh, can you give me an overview as to, now, I know we started this process for very, very aggressive early on regarding reducing the population of individuals who are on state road. But we lost about half of the early reductions that we had in the jail population. What's your thought process around
that? Yes, Councilman. So one of the reasons that the jail population was able to reduce so drastically, in addition to the hearings we were doing, is because there was a limit on people that were entering the jail. And that was partially due to the police department's policies of limiting the number of arrests. There was categories, as you remember, of certain cases that would not be charged initially, and instead a person would be later arrested on a warrant. That process and that policy did change in late May, early June. So the arrests that we are processing in a given day are now back to close to what they were prior to COVID. So that's one area. Additionally, we have not been able to do the more centralized process of review of releases because the courts have been open in a limited way. So since all judges are sitting in their courtrooms, in some respects, business is back to usual, where in order to release someone, certain individual judges have to make rulings, motions have to be filed, they must be listed. So those things, coupled by the fact that we are not able to dispose of cases in court as efficiently as we used to. There's certain cases that are more serious, where an agreement to release somebody is not possible, and those are usually the subjects of litigation. When we're limited in the amount of preliminary hearings that can happen per day, when we're limited in the ability to do trials, that backlog of more serious cases is just going to build without resolution. So I think that's why we've seen a consistent increase in the jail population. I think over the summer and early in September, we were able to keep the jail population still under 4,000 because all the cases that had been relisted from the spring were relisted again for status. And so there was a second level of review throughout the summer. But now that has stopped, unfortunately, we're seeing that steady increase.
Okay, thank you very much. Councilwoman Helen Gim.
Thank you very much, Mr. Chair. So I just wanted to follow up on the question of the number of young people under the age of 18 who are being held pretrial in the city adult jails. I think we talked about how the number has dramatically increased. So could you talk a little bit about it? It's my understanding that, there's a number who are in there for very serious issues, but, we are trying to figure out how to end direct file, both, especially for pretrial detention, and just trying to understand where your office is on addressing this issue in a serious way.
Thank you. I'm not the best person to answer the question about direct file juvenile. I certainly can refer your question to First Listen Be, who takes a lead in a lot of our juvenile policies, but I can say a few things. One is that we've been committed now for several years to having no juveniles in adult custody. We are in agreement to have the entire population transferred to juvenile custody rather than being on state road. That's something that we've been in talks with the city about for several years. We've also tried to drastically reduce the number of people who are direct file juveniles. We are limited in some ways by the law, which says, according to some interpretations, that we have to file certain types of charges in adult court, specifically first-degree felonies with weapons. But what our office has done is tried to agree to decertification and withdrawal and reslating into juvenile at a more early stage than usual. That used to be something that would happen weeks, if not months, after a person's arrest. We are now trying to get that done at the first possible stage, which is the first listing of a preliminary hearing. So that is something we share your concern about that, and we've made strides to get that number lower. The more specifics, I would have to direct your question to First Listen Be, and we can get back to you.
Right. Except that the numbers show that we were at 13 in March and we're at 31 now. So I appreciate the sentiment. I'm trying to understand what's going on. So is there somebody who could answer that?
I can certainly direct your question to our juvenile team and ask them to respond to you directly, Councilman.
And are they on here now?
No, I don't. It's just Mr.
Okay,
Lee.
so we don't have a response to that.
Correct.
Okay. And I will follow up with it, but I think it's not enough. And I understand that the state laws are problematic. Do you have any concept of what the numbers are? Do you know what the longest, other than individuals who have committed, very serious, if it's a homicide or something? Are you familiar with what the length of stay is for the other individuals? Do you have any information?
I do not have those numbers. I can certainly.
Okay, so you have no information. All right. So I need to go to Bob Listenby to get any information.
Yes, that is correct, Council Member. And unfortunately, thank you very much for your question, your attention and focus on this issue. We know both you and Councilmember Johnson specifically care very much about the justice system as it applies to juveniles and the issue of direct files. As you and Liam have identified, there are some challenges with the state law. We've also experienced some difficulties based off the quarantine status of transferring some juveniles to PJJ-SC. But we will most certainly have First Assistant Listenby contact you to answer specific questions, as well as providing our written testimony with the inclusion of this to council, hopefully by the end of today.
Okay, I appreciate that, Mike. I really do. I mean, I just need to underscore, we heard earlier from from Commissioner Carney, the prison system is not a place where we ideally want to see many people at all, but especially if they are pretrial and they are under the age of 18. It's an inhumane place. They have 2 15-minute virtual visits a week. It's inhumane. They could be held in solitary. There's no amount of exercise or physical activity. We have no idea whether, the kind of services they're getting in terms of education. It's an inhumane place. And I think the underscoring is I'm happy to take answers. We'll take questions. But at the end of the day, we have to move quicker on the young people who are, I believe in ending direct file no matter what, across the board. But especially for young people that we can move out quickly and transfer them over to JJSC. We just have to move faster. So no matter what the answers are, 31's a lot, and we gotta change it. So I look forward to that and appreciate the response. Thank you very much, Mr. Chairman.
Thank you very much, Councilwoman Gim. Any other questions and comments from members of the committee? I do know that we have here Bradford. She has some technical difficulties. Brett, is she back on?
I believe she is.
Here, Bradford.
Yes, people can hear you.
Can you hear me?
Yes, I can. Yes.
Oh, thank you. I don't know if you can see me, but I'm glad you can hear me. One, I want to apologize for the delay. I don't know what's been going on, but we were trying to get in. We were in earlier, and I listened to a lot of the testimony that has been already put forth. And I want to say that I will not reiterate a lot of the points that were made by council. I want to thank council for their just effort in bringing attention to this issue, but also discussing some of these issues and how we can bring forth solutions. So for those who don't know me, I'm Keira Bradford Gray. I'm the Chief Defender of the Defender Association of Philadelphia. As many of you know, my office provides legal representation to youth who are victims of abuse and neglect and to those who are arrested. We also represent 70% of the adults charged with criminal offenses in the city of Philadelphia and all probationers charged with violations in the city. What I want to address today is not only the health and safety of the clients we represent and their families, but also my staff and their family. As many of you know, my office spends the lion's share of our time speaking to clients, as we should, because that is our obligation, not only ethically, but common sense in terms of making sure that we're giving people effective representation. Prior to the prison's new policy to end in-person visits, my staff was going to the prison on a daily basis and conducting almost 100 interviews, in-person interviews per week. And so this was a huge piece of our duties and responsibilities as defense counsel. Our office and our staff goes in and out of those prisons on a daily basis. And we are really glad that we are talking about the public health and safety risk of the people within the prisons, but also we need to make sure that we're looking at the public health and safety risks of those who are going in and out, which are the defense counsel. And so it's good to hear that we're looking at treating individuals who are incarcerated as priority for the vaccine because they are in congregate care. And we do know the super spreading issues and the fact that jails are considered hotspots for contracting the spread of coronavirus. Prior to the joint effort by our office and district attorney's office to expedite releases of incarcerated people, the city of Philadelphia County Jail was the epicenter of the COVID-19 crisis. And so as of April 4th, 2020, the reported high rate of infection in the jail was twice of that of the city's infection, of the city's high rate of infection in any zip code in the city. Some of the things that I want to bring to this council's attention is with respect to the population and what we can do about it. I did hear Commissioner Carney's discussion, and I am glad that the prison is taking more or paying more attention to these things. However, she is the person that houses people in the jail. She doesn't put them in. And so as we practitioners are looking at how people are coming in and not able to come out, we have to get creative and look at opportunities to truly be focused on who should be in our jails and who should not. That's going to require a heavy lift on both parties, our office as well as the district attorney's office. Our staff has done a lot of work outside of the courtrooms to bring forth information that we think is germane for a district attorney to understand about the case and some of the issues the case may present, to see if there are opportunities to release an individual where they do not need to be in jail because, one, they are not a danger to the community, and two, they are not a flight risk. However, we cannot do that alone. There are things that we would ask the district attorney's office to do as well, and that is to take a really close look at some of their cases where they have not had contact with victims or complaining witness, make those a priority. Make sure that victims and complaining witnesses know that if they do not show up or do not contact the district attorney, that these cases are going to sit in perpetuity, which is not constitutional in terms of a person's right, of the accused's rights. And so we have a number of people that are sitting housed in pretrial. Almost 90% of the population have not been sentenced, and they are sitting in a pretrial status. And these cases are pretty much stagnant, and they're going to be stagnant for some time. Our office's access to our clients have been severely hampered. We are now using some of the virtual options that are available, but we have to share that with the entire system, as well as some of the virtual options that we discussed earlier in terms of people seeing their families. I am so happy that the council has picked up on one of the most important things, and that is predatory corporations that come in at times like this and start to overcharge people for their desperation in terms of having lack of options with respect to communicating and being connected with families. We do know this is the holiday season. There's a lot of tragedy going on. And so when people have court dates that are now spread out, not 2 weeks, but 6 months, their likelihood of them seeing their families anytime soon, if they exercise their right to go to trial, is very limited. So people are going to be using telephones. People are going to be looking to reach out. Mental health is at an all-time high. And when people are locked in their jail cells for about 23 hours a day, we know how that impacts them, not only physically, but psychologically. So these are people that are going to be coming out with increased mental health issues if we do not do more to try to figure out who should be in there and who should not, and reduce that population so that they can spread out more and can have an opportunity to do programming and do things that we need for them to do to remain healthy. One of the areas that I just want to bring to the attention, as I said, I'm not going to rehash everything I sent in my written submission, but unfortunately, the areas that we have heard from our clients are a little different than what has been expressed here. There will be different perspectives on how effective the policies to prevent the spread in the prisons are, but our office's experience tells us that no policy, however well designed, is perfectly implemented. When incarcerated people are being transported to courts for in-person hearings, they reported not having access to hand sanitizer, having to reuse PPE that was designed for single use only, and expressed concerns about testing and quarantine practices within the prison. Our attorneys reported that clients did not have access to well-fitted face masks and often arrived to court in interview spaces in masks that did not completely cover their nose and mouths. Recently, one of our attorneys was exposed to COVID-19 when a client who had tested positive for COVID-19 was nevertheless brought to the attorney-client interview space at the prison. The client, concerned for the safety of his attorney, advised the attorney of his positive test results, but it took some time for him to be removed from the interview space. Our lawyer still had to quarantine as a result of this close contact. I use these anecdotes not to condemn the best efforts, but to reiterate that, again, no policy is implemented to perfection. The best way to protect the health and wellness of the people housed or working in the jail is to reduce overcrowding in the facilities and strictly limit the detained population to people who pose imminent risk to public safety, and that cannot be mitigated through community supports. My last point here is that community supports have been largely helpful in this effort. And where we have been able to see a huge success in reducing the prison population with very little recidivism, especially in the area of violent crime, is where we have used our pre-entry initiative and looked for community alternatives to help start to bring meaningful programming to people on the front end. Many of those people have engaged and are still sticking with some of the program supports that we have put in place. It has been working well. They have reduced recidivism. They are doing better than they would be doing sitting in the jail cell. And they are holding on to what supports they have while gaining and building confidence in their ability to cope with such trying times. So with that, I will stop, but I will hope that this council encourages more transparency, more dialogue, and more communications between the partners so that we ourselves are all on the same page as to where we're going and what we can do in being more creative in reducing our jail population, but also protecting the individuals that are exposed on a daily basis. Thank you again for this opportunity to speak, and thank you again for having this very important hearing.
Thank you very much for your testimony. Any questions or comments from members of the committee? I have one brief question here. How does cases are considered for review when an individual have COVID for dismissal? Explain that process.
If I understand your question, you're asking how do we review our cases in our system at the defender?
Yes.
So we review every case that comes in through arraignment, meaning when someone is arrested, we then create a file if we are appointed, and then we begin working those cases up. By working those cases up means we initiate contact with the client, whether they're in prison or out. And when we do that, we then start to get a feel for what the case really is. Once we do that, we then look to see if there are opportunities for release based on the equities that are presented by the client, but also some of the critical areas of health, meaning is this person at higher risk because they have underlying health conditions? Are they a certain age? And are their charges and the substance of the charges something that we can bring to the district attorney's attention so that we can agree, if so, on release. That is our process. That takes a considerable amount of time since we all have to fight to get access to our clients. But that is something that we do for every person that comes in. We have been looking at some of the population designations that we've been given by the prison in terms of people with impending health issues, but also people who have been sentenced, which is only about 100 people that are sitting in on our state road facilities, where there are about 4,200 people right now have been sentenced. Everyone else is in a pretrial status. So that is really problematic, given the fact that our own MacArthur data suggests that 30% of the cases that come into our system are discharged because cases, as you know, come in based on an allegation. There's no thorough investigation whether that allegation is accurate. That actually happens through the court process. Because the court process is stifled, we cannot do that. So you have a lot of people sitting in these jail cells that would get redress if courts were open in ordinary courses of business. So we are trying to do our best to understand the underlying issues of the case, but we are only able to do that with the information we gather for our clients. We cannot assess the credibility or the viability of the district attorney's case.
So right or wrong, a person is just sitting right now until the courts open back up. Is that what I hear you saying?
Pretty much, unless there are mechanisms for release that we have agreed upon, there are no other way that we can get people to address their case, have their constitutional day in court, and really test the strength of the evidence as to why they're sitting in there.
Okay. All right, Councilman Derek Green.
Thank you, Mr. Chair. Also, thank you, Ms. Kia Bradford-Gray, for your testimony and your work in this issue. I know in the beginning part of the pandemic, we had a number of regular calls regarding issues that you just raised. And I know there's been some challenges. And I guess my question is, as we're going into this new year, and you made a point of saying we need better coordination, and I'm curious to see if there's been any steps or conversations in that regard, or suggestion that you would have for better coordination, not only through Public Defender's Office, District Attorney's Office, First Judicial District, but also Department of Corrections. And the reason I raise that because of the safety issue is of concern. I'm sorry to hear about not only the challenges we've had at Department of Corrections in reference to COVID and loss of life, but also the fact that your staff is going into correction facilities as well as district attorney's office and others and members have asked me. So want to get a sense of what suggestions you have going forward as we go into this new year and as we're starting to have vaccinations and then gradually hopefully reduce this pandemic, how we can address these issues in a way that's beneficial to everyone.
Thank you so much for that question. I want to start by saying this: the defender or the defense counsel are the primary people that go into the prisons on a daily basis. The district attorneys, from my understanding, do not. If I'm wrong, they can correct that. With respect to suggestions that I have, we have had weekly calls with the courts, but they are over the phone, and that can be very limiting in terms of the types of solutions that you could bring. Our office has authored an 18-page memo breaking out all different areas where we can start to talk about ways to reduce not only the backlog in our courts, but also the prisons population. We have yet to have a meaningful dialogue on that memo that we put together and sent to all of our stakeholders. We would hope that we can develop small working groups that we meet on a consistent basis, and we start to dialogue about all proposals that have been put on the table. We feel like we are very important partners in this effort, and so we want to be treated as just as instrumental as anyone else when it comes to thought, creativity, or suggestions with respect to those. So your question is well taken, and I'm using this opportunity to ask that all of our stakeholders treat the defender just as in just as much regard as anyone else, and let's have that dialogue about the memo that we put forward. Let's talk about it, whether we agree on it or not, but let's make sure that we carve out time, and specifically not just time for time's sake, but time that allows us to truly delve in to a lot of the issues that we are seeing and that we have been advancing. Using our community resources. Right now, Councilman Green, it is time for us to get really laser focused on what cases cause a risk to public safety and what cases are social in nature, and use and lean on some of our social partners to deal with some of the issues that we see on a consistent basis come in our system. We know that many people are looking at the rise in crime and shootings and thinking that there's a correlation between the rise of people that are in State Road. That is not true. Many of the people in State Road are not there for shootings, are not there for violent crimes. They are there for other reasons that have to do with mental health, social conditions, and drug addiction. We should be dealing with those in ways that we are willing to deal with them before Corona, before we were talking about safe injection sites and making sure people have access to medical help. We need to be doing that right now, because if we opened up courts tomorrow, we could not get through the backlog in a year. So being able to be pragmatic, but also being able to work together to ensure that we're all looking at this through all angles. And it's about promoting public safety, because they have to remember, keeping people in jail about 6 to 9 months without a probable cause hearing, where they cannot get to their families, they cannot get to that job, they cannot be the breadwinner in that household, that does not promote public safety either. That actually promotes desperation. So being critical, careful, and making sure that we're not just doing the political thing, looking at charges and saying, oh, well, that person is charged with this, they have to sit in jail for a very long time, is something that our office is very interested in. And we want to have a real meaningful dialogue, but we want to roll up our sleeves and comb through these cases the way we would if we were able to put hearings on.
Thank you for that response. I think it's definitely an issue, a challenge, especially when you're having to deal with the opportunities or lack thereof of having PC or probable cause determinations in reference to moving forward with a prosecution. But also I want to follow up to some conversations we had in the early part of the pandemic when there could be opportunities to have people transitioned or matters or disposed of from the perspective of information between the DA's office, the public defender's office, where there could be stipulation to various bits of information and some type of determination for that case, or a plea from someone, as well as expediting those matters in reference to the First Judicial District. I know there was some delay in getting that started in the beginning of the pandemic that caused some concerns. How is that coming along now? Now that we've had some months of time, has that been able to be continued and has been able to be efficient so that those people who are able to be removed from criminal justice system, or at least have their cases disposed of, are able to do so?
Yeah, so we are moving in the right direction. Obviously, everything can be enhanced and better served. And I will say this, in terms of pleading, we have been able to reach out to the district attorney when our clients have expressed a desire to plead their case. Basically, they know that this is something that they would want to resolve. But one of the things that we cannot do and we will not do is do sort of a rocket docket type of thing, meaning meet someone and plead them out without the real ability to engage them, but also to investigate their cases so that when we plead someone to a felony conviction, we are sure that this is the right thing to do. We will not give anyone any solace, or we will not do anything for the city's crisis in terms of unemployment or desperation if all we're doing is pleading people out because we want to take kind of the quickest way out and say that we want to reduce our prison by making sure that people get out to plead to cases, to take pleas just to get out. We do not like that type of initiative where you're going to give me pleas just to get out. If I'm eligible to be out, then there should be an agreement to release me. I shouldn't have to plead guilty to a felony just for you to release me. Prison should be for people who need to be there. If they do not need to be there, then they should be released, and we should make sure that we're able to give them that opportunity to address their case from outside and work with their lawyer. So there are areas that we now have to dig deeper to understand the viability of these cases. And that's going to take not just the defenders doing their homework, but also the district attorney looking deeper into their cases and doing more research and investigation in terms of, do I have a witness? Do I have a viable case for the charges that I have imposed? And can we do something different? Areas that we are looking at in the misdemeanor realm is something that we call empowerment, not punishment. And our community has really led the charge with that. They have stepped up in advanced programming that could really serve to be beneficial for those just sitting awaiting for their cases to be heard while out on misdemeanors. Remember, we're not going to resume misdemeanor cases or misdemeanor trials until probably mid-2021. They may start in January, but they'll be far and few between. These people would ordinarily be sitting just doing nothing. Now they are actively engaged in a lot of things, and Mike Lee has been really helpful in working with us to see whether or not their active engagement warrants a release from this system. And that is a really good path because our community, again, has provided far better resources than sitting in prison, and it's been more helpful to keep people engaged and on the right track than we have seen by options that the criminal justice system has. And again, there is no lifetime brand of a criminal conviction when we now have found the social response to their issue. That is the smart way to do things, and that is a way to balance our resources, to use them for things that definitely need to be in this system and make sure we prioritize those things that are plaguing our city with violence. And so if we focus our resources on that, I think that we can do a much better job at clearing out the cases that do not need to be here right now.
Thank you for that response, and thank you, Mr. Chair.
Thank you, Councilman Green. I just have one last question. What is the percentage of inmates that your team has proposed to be released, and the percentage of those that the DA's office has agreed to release?
So we have, in the very beginning, we had a really good system going, but that was because we were looking at what I would call the lower hanging fruit, those who are charged with low level offenses. And I'm just talking about charges. So altogether, we had our office filed petitions in 2,377. 55% of those were agreed to by the district attorney. And so they've agreed to over half of our petitions. A little bit more than over half were actually released. And so that was in that early stage. Now we're at a period where the charges are a little more complicated. And so now we have to look beyond the charges to figure out what the cases are really about. And so this is the sticking point, because when people get charged, once again, average citizens, they get charged on allegations. There is no investigation or mitigation about that allegation. Whether it's credible or not has to be staged for a later time. And so now we're going to be faced with having to really do a little bit different homework outside of the courtroom, where we're going to have to look at and agree what cases can we release from prison and what cases can we not. And that really depends on things that will be outside of our bailiwick, meaning, do you have a complainant? There are a lot of people that make allegations and never bother to come to court. And if that is the case, we need to be looking at who is willing to still go forward, and why are people who have made allegations, why are they not contacting the district attorney's office? Why are they not showing up? And if they do not care to come, why are people sitting for months? And I mean, we have people sitting for 200 days without a probable cause hearing. Probable cause is a very low threshold. People have been serving a sentence without a probable cause hearing. Those are the cases where we need to be looking at where are the individuals that have raised these allegations against this individual, and why aren't we prioritizing them to come forth to talk about whether or not this case should be here.
Thank you. Councilman Isaiah Thomas.
Good afternoon, everybody. Thank you to Councilmember Johnson for calling this hearing. This is an important conversation. Thank you to my colleague, Councilmember Dom, as well, for stepping up to try to help address this issue. And thank you to the public defenders and the other partners, the district attorney's office and other partners. So we're working together to try our best to address this issue. This hearing so far has been really informative. I think that the questions have been very probing and put us in a position where we can really figure out what's going on, and most importantly, what can we do about it, and how can we all work together to improve. So thank you to Commissioner Carney as well, too, for making herself available. And my question for Public Defender Bradford Gray, just listening to your testimony and thinking about some of the hearings we've been in and the conversations that we've been a part of, and this idea of folks being arrested and being released, and thinking about it through the lens of COVID, as well as looking through this idea of the gun violence problem that we have in the city. How do we know that most of the people who you're talking about specifically as relates to this advocacy effort, when you're advocating for somebody to be released, like, how are we sure that this effort is not one that's impacting the gun violence and the crime that we're seeing in the city? That's actually my only question, Mr. Chair.
Thank you for that question, Councilman Thomas. That is a very great question, and I really do appreciate that. We have been tracking the number of people who have been rearrested, who've been released through the initial COVID release initiative. And I said that is about 1,500 people. Out of that, 15 of that were rearrested for a firearms offense. So 15 out of the 1,500 people, I should be exact, I'm sorry, 1,474 people released. 15 of them have been rearrested for firearms. So the lion's share of people who are re-released have not been rearrested for firearms. And that is something we are tracking, because we do understand that we want to think carefully about what we're doing, and we do not want to be reckless, especially at a time where we are really juggling and balancing reform and public safety, which both are synonymous and both can promote public safety if we do it right. So that is something that we have taken on, because we do not want to be contributing to some of the issues that the city is already dealing with as it relates to gun violence and public safety.
Thank you, and thank you, Mr. Chair.
Thank you very, very much, Councilman Isaiah Thomas. Any other questions or comments for this panel? All right, thank you very much for your testimony. Would the clerk please call the next panel?
Claire Shubik Richards.
Hello.
Hello. How you doing, Claire?
I'm doing well. Let me get this glare off of me. Is that okay?
that is.
Absolutely. To state your name, your organization for the record, and begin your testimony.
Sure. My name is Claire Shubik Richards, and I am the Executive Director of the Pennsylvania Prison Society. First of all, thank you for calling this important hearing and for inviting us to testify. I'm going to start by briefly explaining who the Pennsylvania Prison Society is, and then discuss it, and then I will take a moment to discuss what we know about what's happening up at the Philadelphia prisons and what we know needs to happen to save lives. The Pennsylvania Prison Society is the nation's oldest human rights organization. We were founded in 1787 by signers of the Declaration of Independence, including Benjamin Rush and Benjamin Franklin. Our mission since 1787 has been, in the words of our Constitution, which was written at our founding, to alleviate the miseries that are the natural attendants of prison. To say that in contemporary language, our mission for the past 234 years has been to end abuse and mistreatment in Pennsylvania's prisons. We are written into Pennsylvania law as having access to all people incarcerated in county and state facilities, and we use that access to monitor prison conditions, advocate for humane conditions, and we serve as the ombuds for people incarcerated in Pennsylvania's prisons and jails. To give you a sense of what our work looks like today, since the start of the pandemic, we have responded to over 5,000 inquiries from family members with incarcerated loved ones in Pennsylvania's prisons and jails. We deputize a corps of approximately 300 volunteers across the state to go meet with incarcerated people, identify when there are issues related to conditions, and advocate for their resolution. We have dispatched about 1,900, we have dispatched volunteers to approximately 1,900 individual incarcerated people during the pandemic to address individual concerns. And we have distributed approximately 2,000 surveys about conditions to people in custody. So that's who we are. Now I'm going to tell you a little bit about what we know is happening in the Philadelphia prisons and what needs to happen to keep people safe and save lives. The first thing the threshold issue for keeping people safe is getting people out of harm's way. As we all know, here in month 9, congregate care settings are about the most unsafe place for someone to be during the pandemic. So the threshold issue is to get people out of harm's way, to get people out of congregate care settings. As you've heard from the panel just before me, the criminal justice stakeholders in Philadelphia did yeoman's work, particularly at the beginning of the pandemic, to get people who did not need to be in the prison out of the prison and to a more safe environment. I'm just going to put the reduction in the Philadelphia prison population during the pandemic into context. By the end of October, the number of people at State Road had gone down 8% from before the start of the pandemic. In comparison, at the end of October, the number of people in the Allegheny County Jail had been reduced 28% since the beginning of the pandemic. Montgomery County, 33%. Center County, 14%. I'm now going to put this into perspective with other large cities around the country. New York City, similar to Philadelphia, around 8%. But I will note that New York City has essentially the same jail population as Philadelphia, although it is a city of 5 times the size. And Wayne County, Detroit, a reduction of approximately 40%. Now, there are a lot of factors that go into how you can safely reduce the prison population, how you can identify who is not a public safety risk, and get the mechanics of the court system and the criminal justice system to move and release people. All I mean to point out is that there are many other jurisdictions here in the Commonwealth and many other big cities that have been more successful in getting those wheels of the criminal justice bureaucracy to move and to get people out of harm's way. Okay. The second issue is, once you have gotten people out of harm's way, for the people that remain in the jail, in the congregate care setting, what are you doing to mitigate the spread? So here's what I want to really acknowledge the Philadelphia prison system for doing. From the get-go, the Philadelphia prison system started quarantining new admissions and eventually started testing new admissions, right? The way that the virus gets in to a facility is from the new people coming in. And the prison has done a really excellent job of making sure that new admissions are quarantined and at this point tested. The other group of people that come in and out are staff. They come in and out every other day. And so if you're quarantining and testing new admissions, really the only way the virus is going to get behind prison walls is through the staff. And we are delighted that the long overdue measure of testing all staff is underway. But what we have called for since the beginning of the pandemic is regular rapid testing of all staff, as is done at Rikers Island, and as I believe most staff people and their families would like, so that they know that they're keeping their families and their community safe in addition to their workplace. As you know, the CDC has recommended regular rapid testing of staff for nursing homes commensurate with the degree of community spread, and a similar principle should be applied to prisons. Okay, so what's it like, and what do we know about what's it like at in the Philadelphia prisons today? So we field hundreds of complaints and letters from incarcerated people and their families. And this is what we know. In the state system, most people are getting out of their cell for 45 minutes a day when there is an outbreak in the community, as is happening in most of the 23 state prisons. And as we also know, from the over 800 surveys that we have from people in state facilities, 45 minutes of out-of-cell time a day gives you enough time to decide if you're going to shower or if you're going to make a phone call. In the city, for the last several weeks, we have been getting reports that people are getting out of their cell for 15 minutes a day or not at all. We understand that with the lawsuit, there is now a requirement for 45 minutes of out-of-cell time, and we look forward to seeing that being implemented. But 15 minutes of out-of-cell time or no out-of-cell time does not even permit the calculation about whether you're going to shower or use the phone to call a loved one. It permits essentially nothing. We know from the court reports in the Institutional Law Project and ACLU court filings that in the majority of housing units, as much as earlier this month, in the majority of housing units, people were reporting that they were not getting out of their cells at all. We know that it is a prison department policy to distribute soap on a regular basis. But we also know from the calls into our office and from the public filings in the ACLU suit that in almost every housing unit, you have people reporting that they are not getting their allocation of soap and sometimes having to go to commissary. And I just want to point out that people are having to use soap to not only wash themselves, but also help maintain cleanliness in their housing unit and maintain their masks. Now I want to turn to masks. the prisons should be commended for distributing masks and for making their own masks. We hear again and again, generally, of high compliance, not universal compliance, but of high compliance among staff for wearing masks. However, we also hear and have seen that there are significant deficiencies with the masks that are being distributed to incarcerated people. These masks are being made on site according to Department of Corrections specifications. We know that the Philadelphia prison is using the pattern provided by the state DOC. But we have seen and we have heard that the way that these masks are being made, the quality assurance that goes into making of these masks is pretty low, that the masks are not snug fitting, that the elastic either doesn't go around the head so that the person can't keep the mask on, and that the elastic on the chin is so low that it is pretty useless on the bottom. As a staff person of mine who went out a few months ago to interview some people who had some complaints about their experience at State Road reported, she said to me, these masks are not anything that would be recognized publicly as a mask. If you saw somebody walking down the street with a mask like that, you would immediately move to the other side of the street. The other issue that we have heard repeatedly, actually just during the last 2 months of the pandemic, is an issue with people paying for goods from commissary and not receiving them. This is not a complaint that we typically hear from State Road, and we've only begun to hear it in the last 2 months, but we have been hearing it with some frequency. I heard earlier in this hearing concern about exploitive practices of charging incarcerated people and their families, and I would suggest that people purchasing things from commissary and not receiving them would be another example of the type of practice of preying on poor people that the city does not wish to engage in. Okay, what is there to be done? So that's what we know about what's happening in State Road. I'll say one other thing actually about conditions. We have distributed a survey about conditions to about 2,000 people. The majority of people that have filled out the survey have been in the state facilities. Of the 800 survey responses that we have analyzed from the state, approximately 40 people report to us that they feel safe while incarcerated in a state facility, and about 60% report that they feel unsafe. Now, we don't have a very big sample size from Philadelphia. We only actually have about 50 surveys from people incarcerated in Philadelphia, but we have yet to have a survey respondent report that they feel safe up in the Philadelphia prisons. Okay, what is there to be done? First of all, get people out of harm's way and release as many people as safely can be released as possible. That's what the panel before me started to speak to. Second, regular rapid testing of staff. That's the way the virus is going to get into the prison. Third, part of the reason why the commissioner and her staff have been reluctant to allow people out of their cells, and I know that earlier people were referring to it as solitary, but it's really worse than solitary because you're stuck in your cell for 24 hours a day with another person. The reason why the commissioner and her staff have been reluctant to let people out of their cells is, first of all, to prevent spread, but also because of staffing shortages. This is also a problem at the state, and as a result, the state has just allowed for an emergency appropriation of $175,000 for emergency supplemental staffing. I would suggest that if the lack of movement at State Road is because of a staffing shortage, that the city also investigate providing supplemental temporary staffing. The city is currently in litigation for which it will have to pay significant attorney's fees. I think the city would rather spend the money on mitigating the issues and not keeping attorneys fully employed. Finally, I would suggest that most of the information that is currently being provided in the court case and to you is based on who's complaining. I would suggest, and the Prison Society is happy to assist, in conducting a survey of all people at State Road to have a more informed understanding of what's really happening. Thank you so much.
Thank you very much for your testimony. I just want to ask Commissioner Connie a question regarding just clarification regarding the 3 hours out that she mentioned earlier versus the 15 minutes that individuals are saying. Commissioner, if you're still around?
Yes. And so it's not an issue of staffing particularly. We had been allowing and really facilitating inmates to be outside of their cells for more than 3 hours. On the occasions during the week, which were primarily 2 days out of the 5 where we were challenged with staff leave. And that staff leave is for accrued leave, COVID-related leave, and the projected built-in leave limits. And so to say that blanketly that's happening 7 days a week is not correct. We've provided information in response to the courts. Any declarations that have been submitted without going into detail for the ACLU case, we have to provide reports, and we refuted a majority of those declarations that were obtained from individuals reporting that they did not have access or receive time out of cell. And so what we were able to provide was if you have a unit of 100 people and 6 didn't receive it, why is that? And so we were able to provide the information. Also, if there are issues regarding commissary, we address those issues through our grievance process. We have had uninterrupted access to people purchasing those goods with very minor incident. And if so, there's a mechanism placed, we've addressed that. As far as the masks, the initial blueprint in working with the Department of Corrections of Pennsylvania, we transitioned from that mask design where we now provide a face mask that is fitted here and then has ear loops. The initial design did have the original elastic straps. We found that inmates were wearing them improperly, although we have provided a robust educational campaign. And so we now are issuing the mask with the 2 loops behind the ear. So there are some of those first generation masks that exist, and we exchange those out. No one wants anyone to be sick. So we transition from that. And so that speaks to all of the things we're trying to do to mitigate. But the bottom line here is we're in a congregate setting, everyone agrees. We're doing all that we can. We're about to do the universal staff testing, and now the second round of universal inmate testing. The goal here is how do we reduce the population, but still understand we are not immune to COVID. This is not a situation where we can just say, oh, wow, it shouldn't happen here at the prisons. But we've been responsive to mitigating the spread. And we've addressed the concerns along the way. We've responded. And so we'll continue to work to improve where we know we can. But I just wanted to give you those updates on where we are at this time and in response to the comments.
All right, thank you very much. Any other questions and comments from members of the committee? All right, Commissioner, another question. Will you and your team be engaging in regular rapid testing of staff members and inmates? Do we have the capacity to do that?
At this time, Councilman, we have to discuss that further. The initial rollout is for the one-time universal testing, but we'll need to have an additional conversation if that were to continue.
And then last, I think I read something in the paper regarding the combination between the city and the state of mandatory testing and folk not being able to be tested because it shouldn't be mandatory. What's our official policy on the city side for staff?
Well, the city has not mandated testing early on, and I'd like to also put in on the record here. We knew we were challenged as a city with the number of tests that were readily available for all Philadelphians, let alone the workforce. So now we're in a position to do so. We were exploring this before the court order came through. The court order has now mandated us to do that. So for the prisons, we're going to go ahead and do our one-time mass testing. I'll defer to the city regarding their position for the other workers.
Okay. All right. Thank you. And excuse my lack of clarity. I was just more so focusing on staff at the prison system. I think on the state level, I think there was a union head who objected to mandatory testing. So I wanted to make sure what we were doing on the city level was clarified for the public. Okay. All right. Thank you very much. Thank you, Claire, for your testimony as well. Would the clerk please call the next panel?
Candace McKinley and D.
Candace, how you doing? Please state your name and your organization for the record. And
okay. Hello, my name is Candace McKinley. I'm the lead organizer for the Philadelphia Community Bail Fund and a member of the No 215 Jails Coalition. I want to thank the committee for holding this important hearing. Since March, we've been among those raising the alarm about the dangers of COVID-19 in Philly's jails, urging the FJD and DA Krasner to release people, the mayor and city council to do everything in their power to safeguard the lives of those in prison and Philly jails. In the meantime, we've worked hard to post bail for as many of our loved ones as possible. BCBF and our sibling bail fund, Philadelphia Bail Fund, have spent over $4 million to buy back the freedom of 712 people since March. This number includes pregnant mothers, children, senior citizens with debilitating illnesses, and folks who caught COVID-19 while in jail. While we are proud of the work we've done, we know that we can't raise the funds needed to bring home everyone held in Philly jails simply because they are too poor to pay bail, nor can we bring home the many more trapped by detainers. Mass release is the best way to halt the spread of COVID-19 inside the jails. This pandemic has already claimed the lives of 311,000 Americans, including Yvonne Harris, a Black mother of 3 imprisoned in Philadelphia. Yvonne suffered from epilepsy and was 4 months away from her release date when she died. Despite her medical fragility, her application for early release was denied. In the spring, Philadelphia managed to achieve a small reduction in the jail population, but the population has since soared to pre-COVID levels. Now, over 4,000 people are imprisoned in Philly jails, with infection rates rising. On December 19th, there were 149 cases reported. That's a 249% increase from November. And the actual infection rate is much likely much higher, as we've heard, because the prisons are only doing limited testing. People are held in obscene, filthy conditions, with folks inside reporting to us a lack of heat, mold, roach and rat infestations, a lack of clean water, no access to cleaning supplies, a lack of PPE, an increase in abuse at the hands of guards, including withholding water and food as punishment, and little to no access to basic medical care. The Department of Prisons' response has been to increase the use of solitary confinement, a practice that is psychological torture, and lockdowns. People held in Philly jails may only get 20 minutes outside their cells to either shower or make calls. Folks tell us inside that they have spent days sequestered in their cells. The torture has been widely practiced since the spring, and with the pandemic now reaching its 9th month, there's no telling when this practice will end or if folks will one day be denied time outside their cells altogether. I'd like to end my testimony by sharing the words of a woman in prison on State Road. JP is a Latina mother and college student who was arrested for the first time and in prison pre-trial on $400,000 bail. She caught COVID-19 while in jail. I'm just going to share my screen. Oh.
Thank you very much, Candace. Is Dee going to testify also on your behalf?
I believe so.
Yes, how you doing?
Pretty good.
Good afternoon. I want to thank Councilman Kenyatta Johnson, Councilwoman Cindy Bass, along with other members of Philadelphia City Council for holding this important public hearing regarding the impact of COVID-19 in Philadelphia's jails. My name is Dee. I'm a daughter, a sister, a loving aunt to nephews, and most of all, a human being who is worthy of life. In May, I was at risk of losing that life and all that I love. I was arrested in May during the spike of the first wave of the pandemic. I sat at the police roundhouse at 8th and Race for a day and a half before my bail hearing. The cells at the station were dirty and unsanitary. They were clogged toilet sinks with feces, the smell of urine filled the air, used sanitary napkins, and old food eaten by others were present in the cell that I was in. In each cell, there was one steel bed with no mattress, used by pairs of different people every 36 hours without cleaning rotation of cells being disinfected. There was no space to social distance. And might I add, I actually worked as a disinfectant worker during this time, and I knew about proper protocols of disinfect, which I did not see whatsoever during my time there. But the misery and exposure to life-threatening conditions did not end at 8th and Race. I had my bail hearing, and in 2 minutes, and based on mere allegations, the DA requested I be held in jail. The judge set my bail at $10,000, meaning I needed $1,010 to return home. Can everyone hear me or see me properly?
Yes, I hear you and see you loud and clear.
Thank you. I thought that in this country, you are innocent until proven guilty, but that isn't my reality. Going through the bail hearing, I learned the presumption of innocence means very little when your skin is black and your bank account is nearly empty. My freedom was taken away in the amount of time it takes you to order a fast food menu. Unable to pay for my freedom at that time, I was hauled off to Riverside Correctional Facility, RCF. At RCF, I observed none of the staff wearing masks and abiding by state mandates of social distancing, temperature checks, and using hand sanitizer. I was given 5 numbers to provide to the jail to call my loved ones, but there was a delay in phone numbers being processed in the system, making it difficult for me to contact my loved ones to let them know where I was for up to 48 hours. I had to use another inmate's phone credit to make calls and receive communication. There was no option for virtual calls at that time. Or at least for those that were put in the solitary confinement quarantine unit. And I stress solitary confinement. I was put on the quarantine block and was confined to a cell alone. The cell was not cleaned during my time there. I was given only one cloth mask, and I actually kept the mask, and it barely stayed on my face. And no cleaning supplies provided to clean the cell. In real time, I was locked in that cell for 23 hours a day. I was locked in that cell for 23 hours a day. For 15 to 45 minutes, based on who was the staff on that shift. When I say that, I mean the personality of the staff on that shift, who lived up to the true work ethic of a correctional officer if they wanted to during that time, if they wanted to let you out. Might I add, due to these level due to these leaves of staff that was mentioned earlier, that should not be a hindrance to individuals who are inmates with their freedom time, of what I call it, hindering their freedom time, because just coming out of that small space, especially spending so much time alone, and you weren't used to that like myself. During that recreational time, we received no temperature checks or checks for test results. It was a chilling experience as it was extremely cold, which under cold conditions, the virus could be susceptible to spread more. But it also broke me down mentally. Sitting in a cold cell for that long, only able to look out of a small glass window in the door, would break any human being. Witnessing the hurt and terrible conditions for other women like myself, situations such as a social worker cursing at a 19-year-old inmate. So to answer the question of young people being in there on that block, I observed that a 19-year-old inmate who was a repeated offender who had just been there the week before, which she stated to the social worker and yelled to the social worker, who literally screamed out for help, stating she had no family and needed help. And this social worker continued to belittle this young lady and eventually left her with no supports, which I took the social worker's name. I watched another guard gay bash another inmate due to her experiencing cabin fever in her cell and wanted to come out of her cell for rec time. I myself pleaded with one of the COs to let me meet with a social worker. And what she told me sticks with me today. She said, honey, it's easy to get in here, it's hard to get out. I was told to put in a request to meet with this social worker, which I did, and I never met with one. The office was across from my cell, which I could see, and it was empty. It stayed empty. I was able to get out not because of the system, but because the Philly Bail Fund, which I appreciate, paid the $1,010 in ransom for me to come home. Thankfully, I only stayed in jail for a short time, but as far as I'm considered, one day is one day too many when you're dealing with a deadly virus. I'm not sure how long I would have made it in there. My experience still sticks with me today and has caused trauma and stress, knowing how you can completely and grossly be stripped of your humanity. Make no mistake, by putting human beings in these conditions, you, our city, are saying their and my life matters less, if at all. I'm asking you all to change that today. I'm asking to heed our testimony and truly imagine putting yourself, Commissioner, your children, your loved ones in my shoes. I'm asking you to free our people from these death traps. I'm asking you to make sure our neighbors behind bars are treated safely and their lives are not put at risk. Like you, they have families. They have hopes and dreams. They are human and thus deserve to live and not die in a cage. Incarcerating a person during a pandemic simply because they cannot afford cash bail is cruel, period, especially during a pandemic. I understand mitigation, Commissioner, but like Councilwoman Bass inquired about, that confinement being solitary is unacceptable. And I strongly felt the psychological effects, as you can see visibly now, of this process, which I was not exposed to anyone prior with the virus and still wasn't. Thank you, Madam Chair, Councilman Johnson, for your concerning questions and remarks in regards with this. Commissioner Carney, I believe, is living a fantasy world. I feel, based on my experience, many things were not true. Maybe some things have changed since I was there, but I know now, especially after the commissioner's testimony, that staff work ethics, lack of care most likely did not change, hence why we are here today, especially due to no numbers provided on dashboard and no released numbers, just talks of numbers. If we can have a mama's parade during the height of the pandemic, why can't those incarcerated utilize shields, masks, gloves, hand sanitizer to interact and communicate in a humane way, not in confinement like how I was subjected to? To pay for visits is unjust. People incarcerated are already paying for an allegation held against them along with fees that come with that for bail. People can't afford bail, but you want them to afford to make calls and visits which should be entitled to them. They are being put into incarceration, not held there voluntarily. Any money for post-release, I did not see any initiative presented to me while I was in transition of housing, being homeless, upon post-release. Thank you to Councilman Don for your wonderful Christmas gift, too, to assist those who cannot afford those costly visit fees. Change happens with proper, consistent communication, supports, and follow-up. I am a social worker. I know this. There needs to be surveys done by post-release inmates like myself. These surveys I heard of, I did not receive one. I wish I could get one. To evaluate the precautionary practices of incarceration process, prison system, and staff. I would guarantee you would, based on those responses of the truth behind what is really going on in the women I met on the everyday and addressing this issue within the facility would come to light. Empowerment, not punishment, could also be beneficial for those sitting, waiting for their cases to be heard, not just for misdemeanors, because I heard for misdemeanors, but also for pending felonies as well. I am engaged in the community. My track record speaks for itself. So Counsel Bradford Gray, I challenge your testimony and asking for that same advocacy you mentioned. Cases like mine, as Counsel Bradford Gray mentioned, should be reevaluated and dissected to see if petition can be filed and more resources and advocacy provided to assist my well-being. I am charged on allegations, whether credible or not. But based on my experience for even that short period of time and thereafter, I was and currently am treated as if the allegation is credible, especially by the plea deal given to me a week ago by the DA without status hearing or trial schedule. If we as a city fail to free people and provide them with safe conditions in this pandemic because we'd rather risk their lives than ensure the political will to take bold action, then we should consider ourselves guilty of complete disregard for human life. The Philly Bail Fund invested in my freedom, my health, and my safety. I hope I can say after testifying today that I can say the same for my city. Let our people go. Thank you.
Thank you very much for your testimony. I'm going to acknowledge Councilwoman, Madam Chair Cindy Bass.
Thank you, Mr. Chairman. I just wanted to thank Dee for her comments, and they go back to my original statement that we have to find ways to provide dignity, even during incarceration. That's the moral fabric of the society that we are. And we're not Russia or China or even Nairobi, Kenya, from the piece on 60 Minutes and prison reform and prison issues that they have in Nairobi, Kenya, which was a piece on 60 Minutes last night. So if anybody didn't see that, I really encourage you to check that out. But I just want to thank her for bringing her story to light, and we need to hear more, and we need to hear them over and over and over again. Thank you, Mr. Chairman.
Thank you, Madam Chair. Any questions or comments from members of the committee? Well, Dee, I want to thank you for your courage and your passion for stepping up and providing your testimony. Very, very informative. Thank you very much.
Thank you, sir. I appreciate it. Thank you all. Thank you.
You're welcome. Would the clerk please call the next panel?
Gregory Trueheart, Eric Hill, Aquaria Cheeks,
and David Robinson.
We're going to start with Mr. Eric Hill. Eric, please state your name and your title for the record, and please begin your testimony.
Yes, good afternoon, all. My name is Eric Hill, currently the business agent for District Council 33, Local 159. I want to thank everyone here. No one is to be excluded from the thanks of the union in my office for asking for our participation in this matter. It's been a long overdue matter of concern of the union for support in our efforts to make the living arrangements of inmates and the work atmosphere of representative bargaining members as pleasant and safe as possible. While I was listening to the testimony of current Commissioner Blanche Carney, I started making a little list of the objections that I have. I have a myriad amount of information that I've given to some of the council members throughout the course of this year, but I want to just stick strictly to the comments and requests for answers that were presented to Commissioner Carney. First of all, Commissioner Carney had made mention about quickly addressing the COVID-19 pandemic where it concerned the clear protective glass shields. That is not true. My office, on behalf of Local 159, had repeatedly asked the commissioner for the installation of these glass protective shields. And the reason for the installation was based upon not knowing where the spores from a person's mouth are going to emanate in the atmosphere. You can't control by directly speaking to someone that the mouth spores are going to go in that direction. Once they filter into the air, anyone there is susceptible to lie on any surface or on anyone's person. It took much pushing on the union's behalf for the commissioner to finally give in and strategically place the glass protective shields in the facilities. But when the union, myself and President Trueheart and the interior facility shop stewards and delegates toured the facilities, the placement of these glass protective shields, again, are very strategically placed, and they are very inferior. They do not cover the entire circumferences of some stations where the union, via my office, had asked these installations being placed to protect staff, to protect inmates, and to protect the public that both the staff and the inmates come into contact with. If I implore any council member to, without giving any prior notification, make a tour of any particular facility, and you will see exactly what I'm talking about. It's not set where it's safe as far as the mouth spores are concerned. It needs to be more inclusiveness of the glass protective shields in all the facilities and all areas where the staff, the public, and inmates congregate or may come in contact with each other. As far as temperature checks were concerned, what the commissioner said about the implementation of that is not also true. Again, we're pushing through my office on behalf of the union and its representative bargaining members. We asked for the implementation of temperature checks. When President Trueheart and myself toured several facilities upon the onset of the COVID-19 pandemic within the Philadelphia prison system, we implored to the commissioner to implement these check stations. Her office stated it wasn't necessary unless correctional officers worked in segregated housing areas, or they worked in receiving areas, or they worked in intake areas. It would not be necessary. It was also unnecessary, in the commissioner's office opinion, that for all staff to be stationed with personal protection equipment. Unless you worked in specific areas, it was not necessary. Now we see it was very necessary. As far as the masks are concerned, let me just state this, which is very important as far as I'm concerned. Without the prompting of questions by council members, the commissioner, if you notice, never mentioned the union. She never mentioned the implementation of the union in any aspect of the prison administration's actions in regards to COVID-19. Prior to the COVID-19 pandemic, my office asked the commissioner, as I did with all department administrators, for their contingency plan. All departments, with the exception of the prison system, provided my office with a contingency plan. There was no need for a contingency plan, according to her office, until CDC guidelines and city officials set the guidelines. Why do you need to have to wait for someone to tell you what to do when it also should and would affect you as well, by her being the commissioner and her administration being in one of the same facilities where the level of COVID is as high as it possibly could be? As far as the construction of masks, my office provided a correspondence of contest towards the commissioner's office, because the masks that were constructed on the prison premises within the garment shop. They were constructed by the prisons utilizing inmate workers and staff that were overseeing these inmates. Deputy Commissioner Terrell Bagby addressed my correspondences, and he said that the masks were made of an Egyptian fabric and that they were 2-ply. That was not true. The masks that were created and distributed to both staff and inmates and to anyone that came into the prisons on the onset of COVID-19 were masks that were made from bed sheets that the inmates cut up and put strands on the tops and the bottoms to be tied around the neck and the back of the head of any person wearing it. They were not sufficient. And this matter is very important because an employee represented by Local 159, District Council 33, who contested the use of inmate workers in an area where they did not utilize safe and social distancing guidelines, working side by side with one another, was disciplined. And as a matter of discipline, also was removed from that particular area. Subsequent to receiving his discipline, that employee is no longer an employee with the Philadelphia Department of Prisons or the city of Philadelphia. He thought it was in his best interest to secure his pension, and he thought it was in his best interest to protect himself and his family to leave employment with the city of Philadelphia in conjunction with the Philadelphia Department of Prisons. And that's appalling, to where a person who is utilizing the city for employment and placement of assignment within the Philadelphia prison system to have to make a decision to live or let go based upon how the administration is treating them at that time. The union itself has stepped in on behalf of the administration of the prisons, not providing sufficient amounts of PPE and not providing PPE at all. The union itself, Local 159, has spent well over $16,000 of its membership money to provide representative bargaining members within the Philadelphia Department of Prisons adequate and safe and CDC-approved masks. Whereas the commissioner, as you all heard this morning, stated through Deputy Commissioner Buford, and I have the notes written down here, that they have 1,000 on hand. They have 227 gloves, and they have 971 hazmat suits. When correctional personnel started wearing hazmat suits, they were ordered to take them off because the prison system didn't want the officers wearing a hazmat suit to incite inmates that there's something wrong. But with the onset of COVID-19 within the Philadelphia prison system, when medical personnel came on the inmate housing units, they were dressed in hazmat suits, and they were not stopped by the prison administration in their guise as medical personnel to protect themselves from others that they only knew were infected. Information was not disseminated to the union or to the correctional officers, who this city has named many employment avenues as frontline responders, first offenders, but not the correctional officers. The correctional officers who go to work every day and in some cases spend 8 to 21 hours behind the walls, confined with the same persons that have been remanded by the courts by sentencing to stay behind the walls, and these correctional officers who give their lives, literally give their lives to make sure that the functions and operations of the Philadelphia Department of Prisons are maintained to the best of their ability. As we heard testimony earlier today, we had one inmate give their lives to COVID-19 while incarcerated, and one staff. But that staff was not, what you're not told, that staff was not a correctional officer. That staff was a social worker. And you need to be given the truth. And our testimony here today is going to be and has been the truth. Let me get back on track. When we asked for the temperature checks and it was denied by the commissioner, again, the union, we kept prodding. Finally, we named it COVID-19 pre-entry testing, which is now implemented at all stations, front and back at the prisons. Unfortunately, it wasn't done soon enough because we have many correctional staff that has succumbed to COVID-19, not once, not twice, not 3 times, in some cases, 4 times testing positive for COVID-19. And unfortunately, those employees who utilize COVID-19 leave, once that is exhausted, then they have to utilize, if available, their personally accrued vacation and sick leave. If that is exhausted, and it is in most cases, then they're forced to use family and medical leave, if available, if they haven't already used it prior to that. And if that is exhausted, then they're without pay. Many people in this city have lost their businesses, many have lost their jobs, and now you have correctional officers who are asked to still work, asked to still maintain the dignity of their employment, but without pay. And that's insane. In the prison system, the wearing of the mask is eminent to survival. Staff, inmates, all have masks to wear. In some cases, when there's a deficiency in masks, staff and inmates are forced to recycle a mask that they've been given sometimes a month prior because no one has given masks to the staff or to the inmates. I myself have personally been on tour just recently as of this past Friday, and I witnessed and talked to some inmates where I motioned to them to put their mask on, said, "Sir, I don't have a mask." And the staff, when I asked them, and the supervisors, well, why don't these inmates have masks? We don't have any. Find them a mask. They had to call other jails to find out in their inventory, do you have any masks available to send over to us? And in some cases, I waited, and it took more than an hour for personal protection equipment adequate to COVID-19 and survival and protection to be provided for both staff and inmates. That's deplorable. The union has asked much of the department, much to protect the officers and the inmates and the administrative staff themselves. We have not ruled out anyone from the realm of protection. We've even asked, and it was finally implemented, that roll call where officers usually stand side by side in a semi-military stance for announcement of their posts. Now roll calls are finally being held in areas such as the gym, where safe and social distancing can be practiced, where you can put 6 feet in front of you and 6 feet to the left and to the right of you. Prior to that, the prison system through the commissioner's office felt that wasn't necessary. The wardens of the facilities thought it wasn't necessary. In the midst of universal testing being given to inmates of the Philadelphia Department of Prisons, my office on several occasions from March to now had asked for mandatory testing of correctional personnel within the Philadelphia Department of Prisons, and it was denied. It was said not necessary. Any staff that felt that they were symptomatic of COVID-19 or they had the symptoms, they were told to go to their personal doctor or to a facility that gave a COVID-19 test. Now, since the ACLU court ruling has come down as of the Friday, There's a mandate. The mandate is to provide COVID-19 testing of all correctional personnel within the Philadelphia Department of Prisons. But the commissioner prior to that wanted concessions from the union, concessions that would consist of, should the mandate be made, what amount of time, if available, would an employee be willing to give in conjunction with the mandate? I sent an immediate letter to the commissioner, and I have no problem sharing any correspondences I'm referring to, or which I have sent to some city council personnel from time to time. The mandate now says it's necessary, it's a must. Now there is no room for concessions. And I sent the commissioner a letter saying that I will not, on behalf of Local 159, commit to any concessions. And I also further stated that should the department, by mandate of a federal magistrate, have the city commit to having correctional personnel within the Philadelphia Department of Prisons tested for COVID-19, and should any employee test positive after being tested by the department, should be placed on administrative paid leave. There's no reason why a correctional officer who's putting their life on the line more than a police officer, more than a firefighter, put themselves at further risk of losing their home, their vehicle, the financial stability of raising and maintaining their family. None of that should be threatened. In conjunction with the housing of inmates, during the summer of 2020, the Philadelphia Department of Prisons opened up a dormant facility called Mod 3. That facility had been vacant and unused for more than 5 years plus. The building is made out of metal. The roof had completely deteriorated to where, when it was in use prematurely, rain came through the ceilings and the walls like a rainforest. On the onset of COVID-19, without the union's knowledge, the administration started using that facility. Inmates and officers both complained. That's primarily what was the onset of the ACLU lawsuit filed in federal court by the inmates. But on the other hand, correctional staff, in conjunction with the union, started filing their own complaints. We have a correctional officer who was recently disciplined for contacting the Department of Labor and letting the Department of Labor know the deplorable and dilapidated conditions of a building that inmates, officers, and medical personnel were forced to be in by supervising inmates, and inmates being forced to live in those torrid conditions. That officer was disciplined for contacting the Department of Labor. The reason why she was disciplined was because whomever she contacted in the Department of Labor, and a voice message that she left with someone in the Department of Labor, sent that voice message to Commissioner Carney's office. And in turn, that voicemail was sent down to Captain Robert Rose and the director of the Prison's Internal Affairs Division, and that matter was investigated, and that officer was subsequently disciplined for contacting the Department of Labor by being a whistleblower and letting someone know, in conjunction with the union, the deplorable conditions that officers were being forced to work in, that medical practitioners were forced to provide medical services in, and inmates were forced to live in. I'll leave that up to you to decide what type of conditions that should be listed under.
We're about to wrap this up, Mr. Hill.
Okay, I will. Well, it's a lot to say, and I'm sorry I didn't have enough time, but I would like to have as much time as others before me, myself did have, as well as time for President Trueheart and others that are listed to testify under Local 159.
Yes, absolutely. The only reason why I'm asking you to wrap that part up, because also you have another member of your board and 2 other members, so I'm pretty sure y'all all going in the same direction. That's all. Everybody else had 1 individual piece that actually testified, except for the 215 no bail fund. But go ahead and state your testimony, Mr. Gregory Trueheart.
Like I said, good afternoon. Kenyatta Johnson, I want to thank you for having me on this committee meeting at the last minute. I just found out about it, and I was not really prepared to testify. But I can concur with what Business Agent Hill has talked about and discussed. When this COVID situation first started, our situation was we felt as though that the prisons did not react fast enough. For the first 2 weeks when the city of Philadelphia shut down, they were running the jails status quo. Everybody was out, 50 to 100 inmates out at one time. And they did not start doing the movement in place until almost after 2 weeks when this pandemic started. As far as the masks are concerned, we went through an issue about the color of masks. At one time, we had some officers coming to work with black mask on, dark blue mask, or maybe a red mask, and the commissioner has issues with the color of the mask. And our situation was these officers are on the front line with in a pandemic, in a confined environment, and we shouldn't be worried about the colors of a mask. We should be glad that these people are coming to work during this pandemic. One of our biggest issues we're having right now is staff shortages, staffing issues that we're going through with the PDP administration. We are working dangerously short in these prisons right now during this pandemic. We have not hired anybody for the last almost 2 years. We've had a class that just graduated maybe 2 months ago, 29 brand new officers. 9 officers have already resigned. We've lost almost 200 personnel this year alone that have not been replaced. Now, the PDP administration states that because population has gone down almost 50%, we're under the 5,000 mark as far as population is concerned, that they don't have the resources or the money to hire staff or pay the overtime to staff these jails, these facilities adequately and safely. And these are the issues that we're going through. And you're going to hear the testimonies from 2 of our members that are on the front line in these institutions. And they're going to tell you, like Eric Hill said, we heard Commissioner Buford state that they have 5,000 KN95 masks. We just walked through PICC a week ago, and one of the biggest complaints we have from staff is, other than working alone, is a shortage of PPE equipment. So where's all this equipment going? Are they holding it? When you call the shift commanders up, they say they don't have it. And this is the problem that we're going through, and henceforth, the union has spent over $16,000 to supply our members with KN95 masks, surgical masks, and gloves. And these are the issues that are ongoing. And like I say, you're gonna hear the testimonies from 2 of our line staff officers, and they are more than qualified to testify of what's going on inside the institutions. And I thank each and everybody, committee member, for your time.
Thank you, Mr. Trueheart. Would the clerk please ask for the 2 witnesses that's speaking on behalf of the correctional officers to speak? Call on their name, state your name for the record, and begin.
Good afternoon, everyone. My name is Lieutenant Akira Cheeks. I'd like to thank everyone for having us at this meeting. I would especially like to thank Ms. Helen Jim on the behalf of her concern for the correctional staff. The issue is that the pandemic has to be addressed as a whole. And throughout this whole meeting, all we've been hearing is basically the mental health of the inmates, the physical health of the inmates. But it has to be addressed as a whole, because as well as inmates are people, so are the staff that's working in there. No one took the time to address our anxiety. We have been assaulted just for coming to work. The public addresses us as enemies. We're the blame for a global pandemic when all we did was show up to work. On top of that, we're coming to work and we're not even being paid. It is unacceptable that we work for the city of Philadelphia, being mandated to stay and can't even afford to pay your bills. It's unacceptable that the anxiety is so high that we basically have to talk to each other every day and basically have like a prayer meeting just to walk into the doors. It's unacceptable that our staff members are being assaulted every day just for coming to work and no one's saying anything about it. We have family members who are incarcerated as well. We're not monsters. We're just here to provide a service the best way we can, the safest way we can. But ultimately, we're getting the blame for everything that's out of our control. And I just don't want the public to take into consideration the prisons as a whole. It shouldn't be a divide just about the people who's incarcerated. It should be about everyone who walks into that building every day, whether they're boarding from the back way or from the front. whether they're clocking in or they're being escorted in by the police. And that's a big issue. A lot of the reason why the staffing is so low, because we are unappreciated. We don't feel unappreciated. We are unappreciated. We are belittled. We are disrespected, and then we are told this is what you signed up for. When in fact, we're just trying to feed our families the same way people outside are trying to feed their families. I heard people make reference to people losing their jobs and not being able to pay for inmate visits and things like that. Well, I'm employed and I cannot pay my bills. And it's unacceptable that I walk into a place every day. I clock in every day. I have to mentally prepare for a place that I know is a high possibility I'm going to get assaulted, disrespected. On top of that, I'm not going to get paid. Then I have to come home and be a mother because of this pandemic, there's no school, so I have to virtual school. I have a whole job before I walk into one of the most dangerous jobs there is. And again, not to take nothing from no one else, but the system is not being addressed as a whole, and it needs to be addressed as a whole. The people who work here, the healthcare workers, the social workers, the security staff, the administration, everybody should be held to the same accord. We should all be respected. We should all, in lack of words saying, appreciated for what we do. It's not an easy job. And again, not to take nothing from no one else, but the line staff see it the worst on everybody else. And it's like, we're disrespected by the public. We're disrespected by the people incarcerated. We're disrespected by their families. We're disrespected from people from outside because we don't have a voice. And to a certain extent, we're not allowed to say things, so we leave it up to our union to speak for us when we can't. But this issue needs to be addressed. We have the highest suicide rate. No one knows what it's like to have to walk back into the area after seeing your coworker being carried out on a stretcher, to come in and be told, oh, this is what you signed up for. This is not what we signed up for. The pandemic is not our fault. We didn't cause the coronavirus. We didn't cause the change in administration. We didn't cause the rules of the recreation. All we're here is to provide a service. And I'm just asking that we be heard and that we be appreciated. And again, thank everyone for their time, and especially again to Ms. Helen Jim for bringing up the concerns about the staff. Thank you.
Thank you very much, Sergeant David Robinson.
Good afternoon. Can you hear me?
Yes, we hear you. Go ahead and state your name for the record and begin.
My name is Sergeant David Robinson. I am employed at the Riverside Correctional Facility for the Philadelphia Department of Prisons. First, I want to thank Councilman Keanu Johnson for allowing me the opportunity to talk on Resolution 200690. And just to answer the question to Council Member Helen Jim, the youngest incarcerated individual on State Road is 15 years old. But talking on the fact on the front line, from the front line, correctional officers, just to piggyback off what Lieutenant Cheeks said, we are the most highly disrespected entity in this city of Philadelphia. We are law enforcement, yet we're not considered law enforcement. And the challenges that we're put up against on a daily basis is insane. Madam Chair, she mentioned earlier as far as the inmates being solitary or locked in all day. This actually works two different ways, because when the correction officer comes on that unit, on that block, to a group of 128 inmates who's been locked in all day long, their attitudes, we have to worry about that. We have to worry about everything. Just last night, just because a unit was locked down all day, a sergeant and 2 officers were assaulted and sent to the hospital. And this happens on a daily basis. The assaults on staff since this pandemic has started has been through the roof. And there's no type of, our leadership, they don't seem to care as much. The individual that the business agent talked about earlier, as far as getting disciplined, when they just reached out to L&I about the conditions, that's true. I get emotional because it seems no one cares, and no one, until something happens, that's when a plan is put forth.
Our union's been asking for a contingency plan. Nothing's been addressed. The numbers of correctional staff that contacted COVID-19 are well over 300. Well over 300, and that's facts. When you call the deputy warden who's in charge of contact tracing, and you tell him you're positive for COVID and you'll have to self-quarantine per your doctor, they say, okay, they take your name, take your number, now call your institution. But not one time, anybody that I worked with got a phone call stating, hey, listen, when you're around Sergeant David Robinson, you might have to self-quarantine. I have a whole unit. I worked directly with a lieutenant at that time. No one called anybody. I was positive in April. And no one that I worked directly with had a phone call or anything to say, listen, self-quarantine. Even to this day, if you call and you tell the deputy warden your situation and that you're positive, it's like it goes unanswered and it's actually ignored. And you have officers, some have no sick time, some have no vacation or anything like that. So they're actually scared. I guarantee there might even be officers that are positive and they don't know what to do. They don't know who to contact because nobody put this information forth. And it's always discipline, discipline, discipline. It's always the officer's fault. It's always, well, you should have knew this or you should have known that. If I contact the deputy warden, I'm going to get questioned, well, did you have a mask on? Did you follow the proper CDC guidelines? That's not what we're here for. I'm telling you exactly what it is. I'm positive. Help me out. What do I do next? Contact the people that I were around. You have to do it yourself. As an officer, you have to do it yourself. The department should have been doing this. And it's just sad that there's no real plan to put in place. And it's sad that a judge had to tell the department to test your people. We should have been tested from the beginning, from the very beginning. Now we have units on lock or medical hold. So they say, because you don't say the word quarantine. That's more discipline. So medical hold. I'm just glad I got allowed the opportunity to speak from the frontline perspective because there's no gowns. Officers that work on these medical hold units, they don't provide us with gowns or masks. Every Wednesday, the sergeant's supposed to pass out masks to an inmate. You give one, you get one. All inmates should have 4 masks, should have. But not one time has any supervisor or anybody in the administration came around and say, here's a mask for the officer, here's a mask for the sergeant, here's for the lieutenant, for the captain. Nobody. It's just, you actually have to care. And I don't see any care. None of these officers on State Road see anything or anybody caring about these officers. Thank you very much.
Thank you very much for your testimony. Sergeant Robinson, Lieutenant Cheeks, thank you all for stepping up to the plate and providing your issues and your concerns on the record. And the purpose of having y'all here is to address those issues and concerns that we as committee members have been hearing out and about in our own community with our own constituents. President Hill, I'm gonna give you an opportunity to wrap up with a few remarks before I open it up for questions from my committee members.
As Business Agent Hill, Councilman, Gregory Trueheart is the president.
Thank you.
I'm just to say briefly, we need your help. And we're sincerely asking you to help us. The union can't do it by itself. And in conjunction with prison authorities and administrators, we're not getting any feedback and we're not getting the help that we deserve, we need. And as you said, your constituents are some of the people that are your constituents and other constituents of council members throughout the city of Philadelphia are represented bargaining unit members of the Philadelphia Department of Prisons. And I'm asking you to use your power and authority to help us and help the members of Local 159 and the citizens of the city of Philadelphia. Thank you.
You're welcome. That's Business Manager Eric Hill. And thank you as well, President Gregory Trueheart. And so what I'm going to do right now, I'm going to open this up for my colleagues because they have some remarks, some questions that they would like to address as well. So I'm going to start with the chairperson of the Health Committee, Madam Cindy Bass, and then I'm going to also call on Councilman Helen Gim.
Thank you, Mr. Chairman. I do want to thank Mr. Hill, Mr. Trueheart, Mr. Robinson, and the young lady who spoke. Her name isn't posted, so I'm sorry, I missed your name. But I want to thank you all for being here, and I don't want ever, at any point, Lieutenant Cheeks, thank you, Councilwoman Gim. So I don't at any point want folks to think that the health and safety and well-being of the frontline workers isn't important to any or all of us. So let me just be clear on that. I do have a question though. If Commissioner Carney is still online, it looks like she is. I would like to hear from her. I would like for her to respond and to address some of these issues that have been brought up by the members of the local union representing the workers. Can you talk about why are they not getting PPE? This should have been solved a long time ago. Where is the PPE going? All the other issues, the disciplinary issues. I need to hear some explanation, especially while we have everybody on the line right now, so that if there are things that we need to do, let's get them done. So
thank you, Councilwoman Bass, for giving me the opportunity. And it's unfortunate to hear, and I make strong objection to the testimony today. Since my appointment, all predating COVID, it's been really changing the culture at the prison, how we treat people who are incarcerated, and that's rubbed quite a few people the wrong way. It's a delicate balance. We're dealing with human beings. We have to treat people with respect and dignity. And as Lieutenant Cheeks stated, the correctional staff do not always get that in return. And so balancing that to acknowledge that they do have a challenging job and still holding the population accountable, but treating them with dignity and respect. Changing culture is not easy, and that's what we're experiencing. From the onset, we've worked with the union. We've stood up the list that Mr. Hill has laid out, and we did it strategically, starting with the medical areas that were people working and engaging close up, doing physical examinations on people newly admitted to the system. We didn't know what we were dealing with at that time. And if we're going to all be honest, everyone pretty much thought this would go over in 3 weeks. We're now 9 months into this pandemic. We value the staff, we value the inmates. It's a delicate balance. On one point, I'm charged with you care too much for the inmates. Well, that I do because they're somebody's loved ones. Because I too have had family and friends incarcerated. The second piece is, well, what about the staff? I care about the staff too. We've increased the employee assistance program for staff. We negotiated counseling and trauma sessions related to the workplace. We engaged in a contract negotiations to give staff additional access above the early EAP. Also, we have staff wellness. We've implemented so many programs that's not being articulated here and overshadowed by the pandemic. And so when we talk about we not valuing staff, you cannot run a correctional department without staff. That's your key. We talked about from the onset that we were too challenged with the testing because the testing was not readily available in the country. And then it was a hierarchy on how that testing was going to be rolled out. We worked closely with the health department that when it did become available, then we provided the staff the list of locations on where to go. One of the things that in speaking truthfully, when we talk about managing this has been one of the most challenging times. And when you talk about the infection rate, we could have had 4,300 inmates infected at any given time, in addition to our 2,000 plus workforce. We were diligent to stand this information up. We were diligent. We talked to the union about the classification of being first responders. They continue to present their case, and we've acknowledged in working with them. We have bi-weekly calls every Tuesday and Thursday discussing issues, all things COVID-19. And to Sergeant Robinson's point, he acknowledged the inmates receive masks. They exchange them out every Wednesday if they're damaged. So again, that is a testament to all that we're providing. Staff, they have access to this. Now, if you're saying it's not readily available, the shift commander, we've articulated where to go, how to get that information. We are not stockpiling any PPE equipment. We're not doing that. And while I can object, I understand people's frustrations. This pandemic has taken everything out of everyone, and it could have been far worse. And as you're hearing from the correctional staff, they don't feel appreciated. As again, they say they're public safety. We know that. That's a separate issue that has to be addressed. But when you talk about what we're not doing, we're doing a lot of things good. We stood up, and it was a strategic process. Could we do it all at once in record time? No, we could not. And we would never claim to have done that. But we stood up plexiglass. We put in place temperature checks. We didn't wait for anyone to tell us, because people thought in 3 weeks, this is all going to blow over. We knew it wasn't going to blow over. And that's why we did what we did from the onset. We've been challenged, and we started doing everything instead of waiting for it to be done. From the manufacturing of masks, we did what we had to do until we could get the on-hand inventory that Deputy Commissioner Buford spoke about. So this has been ongoing. We've been sharing information with the staff, with the union. We submit in the cities on our own closed circuit TV system. In the 7th response letter from the city, Mr. Hill had reached out to me and said, Commissioner Carney, there's leave set to expire December 31st, 2020. And I acknowledged it and said, Mr. Hill, as soon as we receive a response back, we'll send that information. We've communicated information from the city ongoing using our closed circuit TV system, which allows people and staff to get the message at one time. They're able to get that. We ensure it's posted. Now that leave is set to expire, but it's embedded in the 7th response. We've given staff and made sure that they knew from our HR what time you could take, what time was available. And all of those reiterations up to the 7th letter has been communicated. In response to Major Gordon, he does have to ask staff a series of questions per the CDC guidelines. And we've been diligent in doing that. So I know there's some, well, why do you have to ask me questions if I'm just self-reporting? Because that's part of the process. So every staff person on the campus, it's incumbent upon us to report to work. I've asked the union to work with me so we could improve the reporting of staff. And if they're honest, they're going to tell you, yes, that's been on my agenda pre-pandemic. Has it been exacerbated because of the pandemic? Yes. And that's my concern. I don't want anyone getting hurt inside these facilities. We want people out. And when we had people out of cell, it was good for both the population and the staff. I've been very clear and transparent in speaking with the union about my thoughts of staff reporting to work who are healthy, to shoulder the responsibility so that you're working alongside a partner so we can let people out. But I think what we need to do also is that during this brief period of time is which we're asking for. We're not asking for the shelter in place to go on indefinitely. It would mirror the onset of the pandemic when we said, okay, shelter in place, do the mass testing, let's see what we have. We're asking for that cooperation and consideration now. Why? Because if you have 100 people infected with COVID-19, if we don't strategically repeat that process to test every single individual, wait for the results, you possibly could end up with 4,300 individuals. It is not, and I wrestled with that decision of going back to shelter in place. That's not what I wanted. But when you talk about what that would look like if you did not mitigate it and just really control for that 2-week period, people being tested and the results being found. We don't have, and I'm speaking to you, the bottom line, I want people out of the cells. We worked up to that. You heard a little bit of the testimony from Mr. Trueheart, but this is a delicate balance. This is a pandemic, and we haven't been here before. So what are you balancing? You're trying to identify, isolate, test information for twofold: to do contact tracing and then to report that information to the health department of Philadelphia to see whether or not we can confirm the test. If we can confirm the test and it was done here in Philadelphia, that's how we're able to confirm it. If the test was performed outside of Philadelphia County, we cannot confirm it, and it's a self-report. So we're working together. We understand the anxiety, we understand the frustration, but we've come this far and we haven't had, and I say this sincerely, one death is one too many. And I said staff. I don't differentiate between medical, correctional staff, or a social worker. That's somebody's loved one who's no longer with us. And staff is staff is staff. And so we understand there's a lot at stake. So those are the factors. We didn't sit here and wait and think about, oh, let me figure out how this is going to happen. This was in record time that we stood up these mitigation factors. So I'm speaking to all the issues that we stood up. I've objected respectfully. Certainly the union, I can acknowledge some of their concerns, and I think it's for a broader conversation. But I'm walking that line. I support staff and I support inmates. Why? Because I support people.
So, Commissioner, I thank you for your comments, but I think that there's a disconnect here because clearly the union officials feel really some kind of way about the treatment and the lack of support that they have encountered. And so I hear what you're saying. I'm not really sure from your statement what you've just said is an actual tangible thing that the members can see, feel, touch in terms of making their working conditions better. So those are the kind of things I was looking for, but I'm not going to belabor the point right now. I do think that this conversation needs to continue, that this should not be a one and done, and that we should have additional conversation with yourself and members of the union to further discuss what needs to be done, because I'm not really clear that we're doing what needs to be done to provide safe working conditions. And furthermore, the idea that we have someone who's working in an extremely dangerous job and is unable to support themselves and pay their bills, I take issue with that. That's not what we're supposed to be doing here. That's not what we should be offering to law enforcement professionals. And that's another conversation that we need to have as well. So, Councilman Johnson, I'd like to reconvene at some point, the commissioner, the union, and some other folks, members of council and members of the committee, to further talk through these issues, because I think that we're not done here yet. So thank you, Mr. Chairman.
Absolutely.
And Councilman Johnson, if I can just as one more follow-up, Councilwoman Bass, thank you. Plexiglass shields have been placed as an additional barrier. We continue with the temperature checks and health screenings at the doors. We have the PPE that's distributed to the facilities. We will take a look to see if, in fact, the facilities are distributing it, because they are available. And we will look into that further for those concerns. But it is available. We've distributed them. We'll follow up with the wardens.
Thank you, Commissioner. Councilwoman Helen Gim.
Thank you very much. First of all, I also want to extend my gratitude to the membership here who testified. I know it wasn't easy. I know you've been through a lot. I think Mr. Hill and I have spoken from as far back as late spring about some of the difficulties and challenges. Lieutenant Cheeks and Sergeant Robinson, thank you so much. We do care. I think that's what you're hearing here. And this is a difficult area, there's no question. And I think what would help with us is continued conversations, both as a council body, but also feel free to pick up the phone. We will not accept, this city council passed a first in the nation anti-retaliation law around workers who reported conditions of health concerns or other types of things. So we will not accept retaliation. I will definitely reach out to the Department of Labor about serious concerns if any city employee or anybody else raises concerns that is about the public health and about their own health. We want to make sure that we can address the situation and find resolution and not have retaliation. So I take that very seriously, and I appreciate you bringing that forward. And, we'll reiterate it. Certainly I think the commissioner understands, but we'll reiterate it with all of our city agencies again. I know Councilmember Bass said that she didn't want to belabor the point, but I will push a little bit again. And Commissioner, I think it's hard to do to navigate this on a public hearing and call. And I do agree with the council member that there is a lot more that needs to be discussed offline, and as well as just, the follow-up that needs to happen. And I do appreciate your stating that, you will double check on distribution of PPE equipment. You will take a serious look at the plexiglass. I think we need a strong commitment around the testing and protections and administrative leave when people have to quarantine or otherwise, or to keep themselves safe. But, I guess I would say, per the council chair, you occupy a different space than I think, and this, than Sergeant Robinson and Lieutenant Cheeks, who actually have to walk the buildings, who interact directly with, the people who are incarcerated there, who meet with their families, and then who go home to their own. And I think it's entirely possible that you can have two different experiences. Like, you could actually walk through Mod 3 as commissioner, as a prison, department commissioner, and see something very differently than what Sergeant Robinson might see or Lieutenant Cheeks might see. And I think part of what we're trying to get to here is not to say that we object to the testimony or to deny somebody else's experience, but to try to figure out and acknowledge that we occupy different spaces. I don't have to deal with what Lieutenant Cheeks as a woman has to deal with. And I do not understand, from a position as a council member, what Sergeant Robinson has to do as he goes home to his family or meets with other people. But I think what I'm struggling with here is what the councilwoman was saying. And I think you started to allude to it, but are there other areas that you heard today where you could make an additional commitment? And we will continue to work with you and with the union membership as well to bridge any gaps. But could you acknowledge any other areas of concerns that were raised that could help us move this forward?
I can, and I can commit to the wellness initiatives that we've stood up for staff, as Lieutenant Cheeks had presented. That is some of the challenges. We've transitioned to the extent that we can to the virtual, but I think staff wellness is very important for this challenging job. And I'm committed to expanding that to see how we can get more of that into the facilities and to staff.
And I do think, Lieutenant Cheeks saying that, suicide and the devastating impact that this has on people. This is a hard job, no matter what. We would like it so that, staff members don't have to apply for or have to openly state that they are spiraling downwards. It's in some part what we would like to seek to do is to have DVH, IDS, and other department agencies be available on a regular and routine basis to staff. And I appreciate your saying that, but if there's other ways that we can help work on that and emphasize that with staff, that would be great. And then I thought I would go back to Lieutenant Cheeks and Sergeant Robinson in particular. What would be your priorities that you have not yet heard addressed that you would like to see, move forward? And if I could start with Lieutenant Cheeks and maybe go to Sergeant Robinson afterwards, that would be great. And again, thank you so much for testifying and for speaking on behalf of yourself, as your families, loved ones, and your fellow coworkers. So Lieutenant Cheeks.
Thank you. One of my biggest concerns, first and foremost, is the pay. Our staff members are owed over, honestly, hundreds of thousands of dollars in back pay that we have officially lost count. On top of that, I feel as though as first responders and as law enforcement, we should be issued hazard pay. We're on the first line. As everyone said, we put ourselves in danger every day, but yet we're not subject to hazard pay, which is just beyond me. So that would be the first and foremost thing. Again, also when it comes to staff who have to call out, no one should have to worry about basically, do I come to work sick or do I lose my job? Because that's kind of the fight that a lot of people are having, because the issue with the time on the books and things like that. People are now putting other staff at risk because they can't afford to lose their job. So that's one of the biggest concerns when I talk to a lot of my staff members. We talk every day, and that's our number one concern is basically the money. We are already underpaid from the beginning. We don't receive hazard pay. And when you do work, you're not even receiving the pay that you worked for. So again, there's no way you should be a city official and have to apply for food stamps or have to apply for some kind of COVID relief for your mortgage or anything like that when you're working for the city of Philadelphia. So that's my number one concern. And as always, again, just the safety of the members, the things they walk into every day. We have to the point where we're trying to enforce this social distancing, as the commissioner says, because everyone's safety is our number one goal. But we're walking to trying to enforce rules, and then we have to the point where we have people who are incarcerated are literally breaking out of their cells. Like, the staff's safety is at an all-time low in there, and that's my number one concern on top of the pay. Thank you all again. Have a nice day.
Thank you. Sergeant Robinson.
Thank you. I just want a mutual respect, also a mutual respect. And you'll hear police commissioner say, my officers. You'll hear Sheriff Bilal say, my deputies, my sheriffs. You'll hear Adam Till, commissioner of fire, say, my firefighters. I've never once heard our leader say, my officers, or it's the staff. We're all on the same team, and I just want it to be like that. But I also want a mutual respect. It has to be a respect level from both sides, honestly. And the pay is one thing that has to be addressed, because there's officers that receive $200 paycheck, and then you'll say, oh, wait till next pay, or we'll work something out. That's unacceptable. Just like Madam Chair said, it's highly unacceptable, and it has to be addressed. And it's not being addressed. But I just want a mutual respect. That's all I have to say.
Thank you. Just for clarity, President Trueheart, could you just give me the starting salary of a correction officer and then the average salary?
Right now, I think if we were to start a class in the academy today, their starting salary would probably be about $42,000 a year. And just to do wage comparisons, I started this job in 1985 at $19,220. So you do that, that's 35 years, and you do the pay disparity between our staff and what we're getting now starting off.
Thank you very much. Thank you, Mr. Chairman, and thank you to everybody.
Thank you, Councilwoman Helen Kim. Councilman Derek Green.
Thank you, Mr. Chair. I want to thank President Trueheart, Business Agent Hill, as well as Lieutenant Cheeks and Sergeant Robinson for testifying this afternoon. It's very disturbing to hear this difference of perspectives when I hear that PPE is being provided, and this is an issue that a lot of departments were dealing with in the early part of this pandemic. I'm not sure where Ms. Carney got the perspective this would only last for a few weeks. But this is something that a lot of departments were dealing with in the beginning of the pandemic, and to hear that this is still an issue now in December, when Mr. Hill just stated just last week he was at a facility and there was a lack of PPE. That's very concerning that we're having these issues, that we're putting our city employees at risk. Clearly, I can hear the tension between both sides. As someone who's worked in this body and other capacities, I know the dynamics between management and labor, but there needs to be some type of impasse to this issue, both in reference, especially in reference to the safety concern that are being raised. And this is something that I've heard about. I had a very close friend of the family who recently passed that was a corrections officer, and I was hearing some of these issues before he took ill, before he transitioned this year, not due to COVID. So I'm asking, I think it's something that other members have stated, and I think both the chairs of the Public Health and Human Services Committee, Councilmember Bass and Councilmember Johnson, in your roles in leading this conversation, there needs to be an ongoing conversation outside this hearing regarding these issues, because it's something that is not acceptable. Also, we're going to be taking a much deeper dive into these issues as we go into the budget process next year, about what is happening and what's not happening, to the extent that even if members of council and others need to have some type of impromptu pop-up at different locations with members of 159 and prison leadership, just to demonstrate this is not just a random occurrence. These issues are still ongoing. And so this is something that I'm looking forward for both parties to come together to address. Also, I think there's issues in reference to, as we move into 2021, that our correctional officers are frontline workers. There's already a conversation going on regarding vaccinations. I know I've seen various labor groups send letters to the city about where will they be in this process. And hopefully that's something that management and labor can come together for the benefit of all officers in our correctional locations in the city of Philadelphia. Councilmember Johnson, Councilmember Bass, look forward to this ongoing conversation. Look forward to the updated information about how this issue is being addressed, so that we don't have to have a more serious conversation during the budget process about the issues not being addressed, that we can address them sooner as opposed to later, before we have some more health challenges in our prison system. Thank you, Mr. Chair.
Thank you very much, Councilman Green. Councilwoman Kendra Brooks.
Thank you, Thank you, Councilmember Johnson. I'm gonna be really brief. I just, after listening to the testimony from the union, from the prison staff, and in general, and just listening through this hearing, I have so many more concerns and so many levels of question come to mind around staffing, around pay, around how people are treated on both sides of this conversation. And I just want to make sure I put on record that I hear concerns at every level. And I'm really interested in taking a deeper dive. And I definitely want to be in all conversations with my colleagues in reference to these issues moving forward. So I'm really appreciate the time for this hearing, but I see and hear other issues that aren't being addressed at this particular hearing that definitely raise red flags. So I kind of siding with Councilmember Green that, yeah, we have a lot more work to do. And I just want you guys to know that I'm listening, I'm here, and I would like to be a part of the conversation before it gets to the hearing level. Like, if something's happening, reach out to my office, because this has definitely been very eye-opening for me. So thank you for your bravery and stepping up and being able to have these conversations publicly. Thank you.
Thank you, Councilman Brooks. Any other comments, questions for members of the committee? Hearing none. So what I'll do as a follow-up, we'll reach out to Business Agent Manager Hill, and you can follow up as relates to the smaller working group as we look at this issue as we move forward with your members.
Councilman Johnson, this is Dr. Herdman. May I add something to the numbers that I reported for you earlier? Recognizing that we are currently testing where we have a suspicion of or evidence of exposure of inmates and staff in particular units, and this may be focusing in the weeds again, and it's not to, I recognize we've just talked about some very important topics, but this is in the weeds. But before shelter in place, with the units where we suspected infection, the infection rate was 21%. And now that we have shelter in place, the infection rate is 4.6%. So as much as we all dislike shelter in place tremendously, and maybe there are variations of it to be considered, it does control the spread of the disease. Thank you.
Thank you very much. That's very, very informative information. I want to thank everyone for their testimony. Can the clerk please call the next panel?
Dr. Jill McCorkle and Martha Williams.
Jill, please state your name and title for the record. Please begin your testimony.
I'm Dr. Jill McCorkle. I'm professor of sociology and criminology at Villanova University, and I'm the founding director of the Philadelphia Justice Project for Women and Girls. I want to thank Councilman Johnson and the City Council for holding these hearings today. This is so important, and I'm going to try to, and there's been so much great and on-point testimony. I'm going to try to be as brief as possible and maybe set some of this in a kind of broader research context. Most of my research focuses on conditions in prisons and also conditions explicitly faced by incarcerated women as well as their children. And so I'm going to direct my remarks to that. And I thought I would open today with excerpts from 2 letters out of about 9 that I received last week from women who are currently incarcerated at State Road. One of those women who is still awaiting trial says, quote, "Honestly, being in this jail makes me feel like a dead woman walking. We have a COVID outbreak in here, and all I was able to do was cry because I was so scared." Another woman who is incarcerated right now in Mod 3 says simply, "I don't feel safe." And quite frankly, they are right to be fearful. In April of this year, Yvonne Harris, who was 48 years old, was the first person in the custody of the Philadelphia Department of Prisons to die from COVID-19. At the time of her death, there were early outbreaks that were spiking in correctional facilities across the country, and some of the very worst state outbreaks in Florida, in Kentucky, in North Carolina, Indiana, Missouri, and Texas were happening in facilities for women. Now, there's a couple of reasons for why that was the case, but by far and away the most significant factor was architecture. Specifically, all of those facilities that were sort of ground zero for the state's initial and most prominent outbreaks were because people were being held in open air dormitory style housing. In these cases, women were being held in dormitory style housing, and women were sleeping very often nose to nose in bunk beds. So it comes as no surprise that in the early months of the pandemics, infection rates soared in those facilities. It is deeply disturbing to me that in the months since Yvonne Harris died, the Philadelphia Department of Prisons elected to move women out of the RCF facility into ASD and Mod 3, much of which that housing is open air and dormitory style, where upwards of 50 women are on a unit together and 6 are sleeping in bunk beds located in the same cubicle whose walls don't reach the ceilings. Now, in theory, that was done in anticipation of significant reductions in the inmate population and in an effort to expand social distance and spacing across all facilities. But the reality is this made social distancing all but impossible for the women in those units and quite literally shifted women from the frying pan into the fire of COVID-19. Compounding matters. In the letters that I received just last week, I'm getting the same kind of reports that are appearing in the statements that are filed in the ACLU lawsuit. Specifically, that universal mask mandates are not being enforced for staff or inmates, of mask shortages for inmates, of insufficient cleaning supplies, including soap, hand sanitizer, and access to laundry facilities. There is, as we know from today's testimony, limited to no testing for staff members, as well as limited testing for inmates, as well as lax quarantine and isolation practices. In addition to these problems, in Mod 3 specifically, there are reports of insect and rodent infestation, of mold and mildew, of inadequate ventilation, of a lack of mental health and other kinds of programming, a lack of privacy when it comes to dressing and using the bathroom, privacy vis-a-vis staff members, of insufficient or no contact with children and family members, and again, as we've heard today, limited time out of cells. So combined, we have here not only a recipe for a COVID disaster, but of a broader humanitarian crisis. And really, there are two crises playing out here, and neither of them are negotiable. The one is obvious, is the COVID crisis. But the second one is the mental health crisis, and it is not negotiable. A mental health crisis comes with isolation, comes with a lack of programming, comes with the inability to communicate with one's child and one's family members, as well as a lack of out-of-cell time. One of the women in her letter stated, quote, "Stress is building up among women because they have not seen their children. They have limited contact with their children. People are on edge and are feeling really anxious." So I just want to make a couple of recommendations. First, obviously, is to expedite releases and to decarcerate. Doing that goes a long way to solving impending mental health crises, as well as COVID infection. And other people have talked at much greater length and with much greater expertise with respect to sort of the procedures of how to decarcerate and decarcerate quickly. But we've got to do better than we've done up till now. Secondly, in terms of mitigating COVID and the spread of COVID in the facilities, I want to echo other recommendations with respect to not only universal testing, but frequent testing with rapid turnaround, with universal enforcement of mask mandates, with a rigorous quarantine and medical isolation plan. And I should note that quarantine is different from lockdown, is different from solitary confinement in the research literature and in most prison facilities throughout the United States. So, quarantine doesn't mean lockdown. And lockdown, it doesn't solve the spread of COVID, because it accomplishes nothing without testing and without universal mask mandates for both staff and incarcerated people. And in terms of dormitory, there's been some recommendations at the national level in terms of what does spacing look like in dormitories to mitigate the spread of COVID. And generally speaking, most of the recommendations coming out of national commissions are saying at least 150 square feet of personal space at all times in dormitory style buildings. And then finally, some recommendations for solving the mental health crisis. 45 minutes out of cell time, as has been recommended by the current court order, is, quite frankly, again, with respect to the research literature, not sufficient. And so the Department of Prisons, City Council needs to be regarding that as an absolute minimum that can only happen for a short period of time. That really, really is insufficient for ensuring people's mental health. Secondly, and really importantly, is expanded and free access to video visits and phone contact with children and with family members. That's going to, in order to ensure that people have regular contact with their kids, the department is going to need to invest in more than 3 iPads so that mothers can communicate with children. And by the way, that of course also has significant mental health ramifications for kids who are on the outside when they can't communicate with their moms and with their dads. And then finally, the department needs to find ways to creatively and safely resume programming, including mental health programs, behavioral treatment programs, and educational programs. All of this will help alleviate some of the problems with the limited time out of cell and with going into lockdown modes, when there are current infection outbreaks. So I will conclude my remarks there, and I thank you very much for the opportunity to speak on this today.
Thank you very much. Will the next witness please state your name for the record and begin your testimony?
Hi, good afternoon, everyone. My name is Martha Williams. I am here as a member of the No 215 Jail Coalition. I just want to say thank you to, excuse me, to everyone, and a special thanks to Councilman Johnson, Councilwoman Gim, and Councilwoman Brooks, and Councilwoman Bass, for putting this committee together, for these issues to be ironed out. What I have for testimony today, or a list of demands that our coalition has, in respect to things that need to be done in regards and in response to this COVID pandemic. First, we would want the FJD to hold and review hearings for every person in detention with the goal of removing all existing cash bails, lifting detainers, and bench warrants, granting early parole to everyone serving a county sentence, and granting release to all youth in detention. And stop detaining people on violations of probation and electronic monitoring. For the DA's office, we would want them to stop requesting cash bail. I'm sorry, I'm having a little difficulty. Can you guys hear me?
Yes.
I hear you loud and clear. Go ahead.
Okay. And agree to all requests for release, whether they are youth or adults. And as far as the Department of Prisons, we would like to be ensured that those incarcerated have priority access to COVID-19 vaccines. Provide incarcerated people with unlimited cleaning supplies and PPE, ensure access to necessary health care, eliminate mold, mildew, pests, and all hazardous conditions in the jails. Provide unlimited free phone and video calls and mailing, and ensure unlimited access to counsel, and provide unlimited out-of-cell time each day. Also, for the police department, we are asking that the arrest policy that went into effect March 18th through May 1st, which halted arrests on certain charges and all bench warrants. To the Public Health Commission, we want the Department of Health to ensure everyone being released from custody has community access to the second dose of the COVID-19 vaccine if needed. I also want to offer testimony on behalf of an incarcerated inmate that goes to lift up concerns that inmates are dealing with. I think we all heard an overwhelming response to mental health and how it is playing out inside the prisons. So give me a second. I will share.
Are we still airing?
Oh, I'm sorry. Can you not hear the video?
No, not at all.
Oh, I'm sorry, guys. I done played that for half the time and you didn't even hear it. I'm sorry. I'm having difficulty over here.
They brought me from Mod 3 to DC, where it is infested with roaches, it's infested with rats. We have no heat over here at all. They have us in the basement, from what I was told from a sergeant, that we're not supposed to be here. That's why they have us hidden in the basement. It's really a condemned building. We're very cold down here. We got inmates that's literally crying and screaming because they're cold. I woke up this morning and I showed the nurse half of my head had turned pale. Taking pale because I'm so cold. We need y'all help. We can't speak up for ourselves. We don't know what to do. We can't adapt to this. And they really put females in a bad place. The COs is beating on the inmates. There's no cameras. I done been smacked in the face a couple times from a CO. There's no cameras at all. Nobody should be treated like this at all. No human being should have to live in this type of environment at all. This is disgusting over here. Most of the black people is being held when they're letting. I've seen a lot of Caucasian women come in here, and the next day they're going. You know what I'm saying? And us, we're black women, and we're being held. Like, you know, with my judge, Anne Marie Coyle, a lot of people know about her. For her to give me 3 to 6 years for one dirty urine is out of control. I'm in school, I'm in GD, I'm in the wedge, I'm in a net center. I was doing everything that she wanted me to do, plus more. What reason does she have to take my freedom and be away from my kids like that? And I need them to realize that black people matter. We're the same people. We need the same respect. We dish out the same love.
Okay, so that is just, a short testimony from someone who is currently being housed at my 3. So I presented this testimony in hopes that something will be done to bring this to the attention of stakeholders who may not see directly or hear directly what is going on. So I'm asking for help on behalf of those incarcerated. I too have an incarcerated loved one. So I can't tell you I can tell you the devastating impact that incarceration is having on those incarcerated and those of us who have to watch what's unfolding inside of the jails. And I'm just asking everybody here. I mean, I've been hearing testimony all day. I hear the back and forth. I mean, this pandemic is hard on every single individual that is alive now. So I'm asking that we keep those who are incarcerated in the front of our minds, and that we do a better job of caring for them. They are our people too. Thank you for allowing me to share and give testimony today.
Yes, thank you very much for your testimony. And can you provide a copy of the recording that you just played? Provide that to my office for the record. And the clerk name is Brett Needlecoff. If you can find a way to get it to her, the same way you signed up to participate in this hearing, we will make sure that that's a part of the record. I do have a question I want to ask the Commissioner Carney. How are we addressing I would say also the mental health of and support systems for inmates during the health pandemic?
Good afternoon, Councilman. This is, I am Deputy Commissioner Terrence Clark from the prisons. The Commissioner had to step off for another meeting. As far as addressing the mental health concerns of our population, we have a private contractor, Centurion, and our correctional officers are our first line of notification when we have persons in crises or that have issues that need to be addressed. Many times it's the correctional officer that will notice these people in need first. And then they are directed to the appropriate channels for assistance.
Has those services have been limited due to the health pandemic, or how do you keep, how have you all adjusted to the transition of still servicing the needs of inmates?
What we have done, as the commissioner alluded to earlier, was we have outfitted all of the areas throughout our facilities with Lexan or plexiglass barriers, and marked everything out for social distance, and the appropriate staff or contracted personnel. Sometimes they go to the housing area, and sometimes their inmate is actually brought down to the office area where the Centurion personnel works. And those areas, as was previously stated, we've had those areas outfitted with the appropriate protective equipment.
Okay, all right. Well, thank you very much.
You're welcome, sir.
Any other questions or comments to members of the committee? I want to thank both of you for your testimony. Thank you for taking time out of your schedule for going on the record, and thank you very much. We're going to take a couple-minute break for public comment.
Mr. Chair, we are now live.
This resumes the Public Safety and Public Health Committee. Will the clerk please call the first witness?
Kara Tratner.
Good morning, council members. My name is Kara Tratner. I'm a Philadelphia resident, and I'm testifying today because I have been in touch with people incarcerated in the Philly jails for the past 10 months through the Philadelphia Community Bail Fund and my work in reentry social services. And in March, I got call after call from people sobbing and having panic attacks on the phone, terrified that they would get COVID and die alone in a cage and never see their loved ones again. And I thought it could not get any worse. In April, I got calls from people saying they got only 15 minutes out of their cells and had to choose between a shower and a phone call. In August, I got calls from women and trans folks saying they were moved with no explanation into even more horrifying and inhumane conditions, with rat and roach infestations and mold and crumbling cells and no clean water or hot food. Are you able to hear me? Sorry.
Yes, I hear you loud and clear. Yes.
Okay.
Keep going.
Message. No clean water or hot food, and 30 people in a cube with no social distancing. And I thought it could not get any worse in August. In September, I got a call from a Black woman who was beaten bloody by a CO with her own handcuffs because there were no cameras in the Mod 3 facility. In November, I got calls from people held pretrial on cash bail who were confused and enraged that the courts were shutting down again, terrified that after 9 months without a court date, they still had no hope of release, even while COVID rates soared to their highest yet. And I thought it could not get any worse. In December, I got a call from a young mother who contracted COVID, telling me she was left alone to quarantine in solitary confinement in the freezing rat-infested basement of the DC facility. She told me she was gasping for air and still could not see a nurse. While the rapid COVID spread in the jails is one of the most dangerous and deadly public health crises that our entire city is facing, it is also one of the most preventable. Council members, I'm asking that you use your power of the purse to influence the FJD and the DA and the Department of Prisons and the mayor to release people before it's too late. I ask that you show our Black and brown incarcerated neighbors that their lives do matter to you. On behalf of all the people who bravely shared their stories with me, I ask that you bring them home now alive, because if you do not act now, it will get much worse. And I'm going to finish by playing a very short, less than 1 minute recording of a mother incarcerated pre-trial on an unaffordable bail at the ASD facility.
They moved us a couple days ago. They put us out, everybody in a bus, no social distance. Everybody was together, handcuffed together, like two in each seat. There's no social distance here. Right now, my unit, I'm in Unit B. There's like 34 people in one queue. Just started to clean this because it's real dusty. I get asthma, bronchitis. My health issue is very bad. I'm in high risk here of my health. Like anything happen to me here. I could die here. I mean, I have a 17-year-old daughter. She got herself out there, and she needs me out there. I'm in major depression. I can't do this. I can't. I'm sorry. Like, they are ignoring me, and I need to get out of here. I'm just scared that something happens to my daughter out there, and I lose everything. I'm high risk. Like, they ignore me. I haven't seen no social worker at all. Like, they're not doing nothing. My life is in danger. Like, I need to get out of here. I need your help.
Are you finished with your testimony?
Yes, that's the end of my testimony. Thank you for your time and for coordinating this hearing.
No, thank you for taking time out of your schedule and being on this very important hearing. Will the clerk please call the next witness for public comment?
Katie Kupnitsky.
Hi, everyone. Can you hear me all right?
Yes, I hear you loud and clear.
Okay. Good afternoon, everyone. My name is Katie Kupnitsky. Before I share my comments, I want to thank those who spoke out in favor of releasing people from our city jail so far, especially Candace and Dee, and all those who emphasize the need to free our young folks for their testimony today. We know, and all evidence shows, that incarceration doesn't decrease violence in our communities and doesn't increase public safety. By every measure, incarceration fails to do these things while causing so much harm to people and families. It is never safe, humane, or in the interest of public health to place our neighbors, loved ones, and community members in cages. The COVID-19 pandemic has simply highlighted existing faults in our systems, and the criminal legal system and the system of incarceration is no exception. We rallied around City Hall in April, calling on public officials to take this threat to our people's lives seriously, and the response has been completely inadequate. Advocates have been sounding the alarm since March because anyone who advocates for incarcerated folks knew immediately that they would be placed most at risk because of existing conditions inside jails, prisons, and detention centers. And unfortunately, we knew our public officials would not prioritize the safety and well-being of our incarcerated community members in this moment of crisis. This was predictable, but it's inexcusable. I've been inside our city's jails where the ceilings leak every time it rains or snows, where there's practically no ventilation, no windows, where it's freezing cold in the wintertime. I want to be clear that this is unacceptable all of the time, and under the conditions of a pandemic, it is even more horrendous. The things that are necessary to protect oneself from COVID-19 are not possible in our jails, detention centers, and prisons. These extreme lockdown measures that are being used to contain the spread of the virus are cruel and are not an adequate response. Our collective response must include rapidly decarcerating and freeing our people to prevent further loss of life. It is long past time to free people and depopulate these facilities to protect people's health, safety, and lives, while also pushing for long-term solutions that decrease our reliance on incarceration so we can get on a path to ending the practice of caging our people altogether. We can begin this process now by increasing the use of community-based measures that the representative from the Defenders Association spoke of earlier. I'm calling on those with the power to do so, to do the same thing that I called on them to do in April and last year, and the same thing that I will call on them to do until we all are free. Free our people. It doesn't have to be like this. We can do so much better for each other. Thank you.
Thank you. Will the clerk please call the next witness for public comment?
Nikki Grant.
Good afternoon. My name is Nikki Grant. I'm the Policy Director for Amistad Law Project. Amistad works with Pennsylvanians who are directly impacted by mass incarceration, and we are one of the founding organizations of the Judge Accountability Table, where we coordinate the Court Watch program. I wanted to give testimony today on our observations on how Philadelphia's criminal justice system responded to this pandemic. Starting in April and throughout the summer, we kept close watch on the courts. Our Court Watch volunteers observed over 800 hearings. Of the emergency hearings for bail reduction, detainer lifts, and early parole review that we witnessed, the majority did result in incarcerated people having the opportunity to be released. However, we noticed a few alarming patterns. First, the primary indicator of whether a defendant would get relief was not anything to do with that individual or the judge, but the ADA in the courtroom. While in some rooms, one ADA would object to very few or no motions, in other rooms, a different ADA would object to most motions. Across the board, we witnessed that when an ADA objected to a motion for whatever reason, judges usually sided with that prosecutor. Furthermore, we were alarmed to see the use of guilty pleas in exchange for immediate release from jail. If someone is deemed not a danger to the public by the DA's office, we wondered why they couldn't allow individuals to be released pending a trial. Second, we witnessed some judges not take seriously the urgency of the crisis, which was the purpose of those emergency hearings. We regularly observed judges denying motions of medically vulnerable people for reasons like previous failure to report for probation or parole. One judge even stated, "I cannot put people's property at risk," in denying a motion for parole of an older man accused of car theft who had several medical issues, including diabetes and cancer. Third, we witnessed that some people who would have otherwise been eligible for release potentially not be released because there was a question of where they would go. The lack of housing, mental health care, or drug treatment in general, much less in the global pandemic, is a tragic indictment of this city. We are not taking care of our most vulnerable. In the coming weeks, Amistad will be releasing a report based on what our Court Watch volunteers observed this year, and I would be happy to share that with this body. Now in this latest wave of the pandemic, the courts are not acting with the urgency of last spring to hold emergency hearings for release. This is unacceptable and will lead to devastation and deaths. We cannot let the situation of the jails reach the levels of the state system, where according to our PA Prison Pandemic Tracker, there have been thousands of people who've tested positive in the last month and over 50 deaths. We need the courts in the city to act and to act quickly to save lives. Thank you for your time.
Thank you for your time. Can the clerk please call the next witness for public comment?
Adriana Akintobi.
Good afternoon to City Council and the community. I want to thank everyone who has shared their voices, efforts, and times today. My name is Adriana Adele Akintobi, and I'm just a regular resident of Philadelphia and an extremely concerned community member. During the deadliest global pandemic of our lifetimes, I have been told by the city to stay home and practice social distancing to slow the spread of the virus, and I am fortunate to have the resources to be able to do so safely. By contrast, those in our community currently incarcerated are stripped of that ability to follow city and CDC guidelines and are in danger of exposure, a threat worsened by inhumane and unsanitary conditions. Philadelphia is one of the most incarcerated big cities in the country, and we've heard incarcerated community members who are disproportionately Black, brown, and poor reporting instances of inadequate access to PPE, hygiene products, health care, and inadequate space to effectively distance. City Council can and must press the necessary bodies to act to prevent unnecessary suffering by reducing the number of people going into and depopulating the folks in the system now. City Council should demand that the First Judicial District courts remove all cash bails, which are often set prohibitively high, especially given that we are the country's poorest big city. Release all detainers and warrants, proactively grant those serving a county sentence early parole, free the elderly and medically vulnerable communities, and all youth held in both adult and youth facilities. As we've heard, there are currently 31 children in Philadelphia's adult jail, up from 13 in March. Free them all. Council should also demand that PPD reinstitute its arrest policy that was effective between March 18th and May 1st of this year, which stopped arrest on certain charges and all bench warrants. Incarcerated people also deserve unlimited access to hygiene supplies, healthcare, vaccines, and other resources to protect their individual dignity and safety, and also our city's collective well-being. In the short and long term, we must see our city's budget as the moral document and reflection of our priorities that it is, and City Council must commit to diverting dollars and resources from the disproportionately funded police into mental health and safe housing, income support, and the resources that make our communities safer and keep folks out of the punitive prison system. Councilmember Johnson recently shared a tweet by the city's Twitter account stating, "For many of us, the holidays can be a difficult time. We want to make sure that everyone has the opportunity to experience comfort, solidarity, and hope this holiday season. Swift and decisive action centering care, compassion, and common sense must be taken to assure that this applies to everyone in the city. We can do this differently." Thank you.
Thank you very much for your testimony. Will the clerk please call the next witness for public comment?
Jamal Hart.
Hello. I'm pretty sure that all of you have been contemplating and really weighing what are the goods, the pros and the cons of what we're trying to do. I urge you to think about this year, this COVID year, this 2020. In June, when George Floyd fell, a lot of people, millions of people took to the streets to march and say Black Lives Matter. In Pennsylvania, with so many Black lives behind bars, with so many people waiting trial and are in jail for nonviolent offenses, they're falling. They're falling like flies. They're dropping. And we know that they are. And you guys seem like you are determining whether their lives matter. We need to be a better people, especially for the individuals that are incarcerated. When those millions of people took to the streets screaming Black Lives Matter, I'm pretty sure they've done their research, and they kept digging, and they kept finding skeletons, and they kept finding bones of what we built this fair democracy on. And we understood that it wasn't fair, usually for the individuals that are poor, that are Black, that are brown. And you guys know that this is something that we need to act on. Now, I'm not asking you, I'm not begging you, I'm telling you that the people wish to see their prisoners free, especially if they are not in there for violent crimes. Like, I want you guys to think about how it is for an individual to be in solitary confinement and to be confined to a closed space, not knowing, when this grim reaper called COVID-19 is going to take hold and take them away. We're getting reports that guards aren't wearing masks. They're not getting cleaning supplies. We're getting reports that, we are not taking care of this very vulnerable demographic that you guys are in control of. We need to be a better people. And I know that you know that we need to be a better people. What type of citizen and public service official do we want to be? Do we want to be the person that sentences these people to death, a slow death, a death that they don't even know when it's going to come? Or are we going to be the people that understands the human element of this global pandemic, and that we are going to free these people so they can live and so they can be better people? toward the population. My name is Jamal Hart. I've been in this for a long time, and I just want you guys to think with your hearts and don't think the way other people told you to think. America can be much, much better, and we know that. So let's be better. Thank you.
Thank you very much for your testimony. Will the clerk please call the next witness for public comment?
Brianna Remster.
Good afternoon. Please let me know if you can't hear me, but my name is Dr. Brianna Remster, and I'm a resident of Philly and an associate professor at Villanova University in the Department of Sociology and Criminology. I study the consequences of incarceration for individuals, their families, and society, including how incarceration impacts people's health. I thank the folks who've already spoken today for doing such an excellent job of highlighting why jails are unique COVID hotspots and the very serious lack of adequate preventative measures and sanitation issues inside Philly's jails for both staff and incarcerated people. Instead of repeating it, I want to highlight two particularly important factors for the committee to consider today. The first is the disproportionate impact of unmitigated COVID in Philly's jails on people of color. I'm not the first person to say this today whatsoever, but as a scholar of stratification, I remind us all that people of color are overrepresented in the city and state's justice systems, and people of color are also more likely to be unable to afford cash bail and more likely overall to be detained pre-trial. Philly's jails are most likely driving up COVID infections and deaths among residents of color. And failing to better address COVID in our jails is disproportionately putting residents of color's health at risk. Second, I urge the committee to consider the impact of uncontrolled COVID in our jails on community infection and death rates. Every single Philly resident is impacted because of how interconnected we all are. We use the same public transportation, we frequent the same shops and stores, and we rely on the same service providers. If we want to control the spread of COVID in our city, we must immediately address COVID inside Philly's jails. For instance, in Chicago, 1 in 6 cases a couple of months ago were traced to Cook County Jail. Every day that goes by without doing more results in preventable infections and deaths of all Philadelphia residents. So what should we do? Jurisdictions around the country have implemented a variety of strategies beyond what we are already doing in Philly. So there are really a number of models to look to, but I just want to echo the decarceration strategies described by the Public Defender's Office earlier today, as well as many of my fellow citizens on this call. There's simply little scientific evidence to justify Philly's cash bail system whatsoever. It doesn't make us safer, and we can reduce the spread of COVID by at least temporarily suspending it. Mass releases like this are happening all over the country, and there's strong empirical evidence that Philly should join the ranks. For the small portion of individuals who the courts deem should remain inside jails after those changes, we need to make sure that correctional staff and incarcerated people are getting vaccinated as soon as possible, as well as, of course, providing additional PPE and regular accessible testing. Together, these strategies will lower the risk of infection and death for residents of color, as well as residents across the board in our city. Thank you for your time.
Thank you for your testimony. Will the clerk please call the next witness for public comment?
Leah Lewis.
Leah Lewis.
Okay.
Good afternoon, guys. I first want to thank the councilman and councilwoman for allowing me to speak. And I also have to thank Dee for speaking on what is really going on inside those walls. I'm just an aunt from Philly who lives in Georgia and jumped when my niece and nephew called with any and all mistreatment. I also want to thank Prison Society, Ms. Richardson. She touched on everything I wanted to speak on today. I was one of the first people to go on No Gun Zone and send him an audio recording of my niece about the conditions that, my niece was placed in when she was taken out of RCS and put into Mod 3. So many So many of you in this conversation received calls from me, including Commissioner Blair and Prison Society. My niece and nephew has been incarcerated going on 2 years without any hearings. My niece also had her first child while incarcerated almost 2 years ago. From March until the other day, she finally was able to have a visit, to see a video visit, seeing her daughter for the first time in months. Where I want to continue on about the conditions, and I know where I want to continue on about the conditions and the no phone calls or the 15 minutes that they do not get to get out their cells, I know I'm timed. The only thing I can think I may have missed during this conversation, and the inmates calling me this morning and wanting me to make sure I ask about the inmates who are putting in requests for medical treatment, and it has been taking them 3 weeks or more to be serviced. It is a time that we come together and get them out of here, for real. We got to do something. That's it.
Thank you very much for your testimony. Will the clerk please call the next witness for public comment?
Lynn Robinson. Lynn Robinson. Alicia Gearsey.
Hi. I want to say hi. Thank you to City Council for having this very, very important hearing. I'm Alicia Dorsey, family community advocate. I would also like to see a joint hearing by the committees on public safety and public hearing for the resolution of 200-690, protecting Philadelphians behind bars from COVID-19, because it's really crucial that we get a handle on that spread of COVID-19 that right now is walking in and out of the jails with the guards and the staff and everybody else that's going in and out of those prisons. I hear horror stories from behind the bars with medical and mental health support neglect before COVID-19, and now it's even worse during COVID-19. Some of our brothers and sisters behind bars are being asked to pay $5 for a flu shot or for any type of treatment for COVID-19. And that's just absurd because most of them don't even have money behind bars right now. And there's no work right now behind bars because they're all on lockdown. So why are they being bribed to pay $5 to get a flu shot? And many are being moved right now. SEI Smithfield is moving our brothers and sisters. For what reason? Like, all of this is being done and nobody's talking about it, but our families are terrified that their family is going to be shipped away somewhere, and we have no idea where they're going to be because we're never notified about the transfer until our family gets to that place and then notify us about them being transferred. Also, there was $108 million in the CARES Act that was supposed to go to help emergency rent and mortgage relief in Pennsylvania. But now that money is being sent to the Department of Corrections because our state failed to connect with the people who needed that money for their rent and their mortgage. So now it's going to be dispersed throughout the PA correctional system. And I really would like to know if we could get the documentation of all this COVID-19 relief that's going on in the prisons, because they say they spent this special amount of money to help our brothers and sisters behind bars. But the only time our brothers and sisters behind bars get help is when they on their deathbed, going to the hospital, about to die, because ain't nobody helping them behind bars right now. They're transferring brothers and sisters that's already sick to pods that aren't sick. So, like, the infection is crazy from what I'm told. To get a transfer, you go to 4 different locations before you land at your last location. So an affected person just went to 4 different locations because they're not getting tested,
the guards that's transferring them is not being tested. It's really kind of scary how they're playing Russian roulette with everybody behind bars. And then they're getting all this special money for COVID relief. I want to know how they're testing the people, how they're testing and tracing the guards, the kitchen staff, the janitors, everything and everybody going in and out of that jail. And then how are they protecting our brothers and sisters behind bars because they're in cages? It's very hard to be in social distance like everybody else said. So I'm not trying to repeat nothing nobody else said. But I really would like to see documentation line for line on those budgets, those COVID-19 budgets that's in the prisons, all this $108 million they're getting ready to get from the CARES Act. I would like to see how they're planning to use that because the neglect is horrific what goes on behind bars. Before COVID-19, they were not addressing hepatitis C, and that's why we still have hepatitis C in our society. COVID-19 is just icing on the cake. Thank you so much for your time. Allow me to be a part of this hearing.
You're welcome. Thank you for your testimony. Will the clerk please call the next witness for public testimony?
Taisha Stott.
Okay. Hi, hello.
Hello.
Hi, can you hear me?
Yep, I can hear
Yes,
you.
hi. How you doing, Tiana? Okay. Councilman. My name is Taisha Stott, and there's like a couple of things that I really want to say and I'm concerned about. First, I need to state I reflect back on what the sister was sharing about, what she wanted to see was done inside of the prisons, because I just fought for my sons, even though my son, at the time, it wasn't no COVID or nothing like that, but the prison has a very distinct attitude towards telling family members about what's going on with their relatives inside of a prison. And my son was in a hole for damn near 3 years, being starved and being bullied by the inmates and everything like that. So I kind of fought my way through and got him transferred to Phoenix. So now here we go here in Phoenix, prison, they got the COVID-19 running around, and my thing is this, I want forms to be sent out to these prisoners so that they can have a person to oversee them while they're in there, because somebody who I just know had a brother that died in a prison, and they gave her the runaround. They never told her that her relative had died, and this was somebody from prison society. And I know this person very well because she was helping me out with trying to get my son transferred out of there. But thank God for Councilman Kiana Johnson. You played a big part in that also, and also the state representative Jordan Harris. I had a few other people in prison society, but now what I want them to at least have some forms and stuff so that they can sign papers over. Pass them out, let them know that it's okay to tell their relatives about what's going on, because my son now, even though, he's in a cell by himself, but he still has to come outside just like the countless others had to go outside, and when they getting sick in there, they're not telling nobody nothing. They giving family members to run around, and they shouldn't have to go through that. If something's wrong with somebody's relatives in them prisons, they need to say something about it. They need to call somebody ASAP. Now, I'm familiar with John Wetzel. John Wetzel is one of the persons that's one of the leaders and overlooks the prisons and everything like that.
Young lady, excuse me. I just want to let you know that the hearing for today is for city prisons, which are basically all on state road and operated by the city. I think what you're talking about with John Wetzel is on the state level. And so that hearing will take place at a later date in which you can provide that information. But today we're talking about City of Philadelphia prisons on state road.
Well, on state road, I believe that all of them should be mandated for release. And especially for those who with a nonviolent crime. Why have them in there if they didn't do nothing violent? And they're being subjected to COVID-19 and there's nowhere for them to go. I mean, it's just it's unfair. And right now with the courts and stuff being closed and it's not really a way of getting a hearing, ASAP, I think that they all should be released, especially for those with nonviolent crime. So I feel as though that they need to be released. why hold them in there? And then when they get sick, you know, the city got a lawsuit pending against them because of the fact their relative didn't have a violent crime and they were supposed to be released at a certain date, but their court dates keep getting pushed. So I feel as though that as y'all should put your foot down, go in there, use your voices, okay? And like the young man said, I'm telling you, I'm not asking you, I'm telling you to go in there and let them know that you need to let them out. They're not dogs. They need to be let go. That's what I gotta say.
Thank you very much for your time and your testimony. Will the clerk please call the next witness for public comment?
Michael Butler.
Michael, are you there?
Michael Butler. Lynn Robinson. Lynn Robinson.
She did not answer.
Okay.
Brett.
Thank you. I believe that is it, Councilmember.
Is there anyone else here who would like to provide public comment on this bill?
I believe we actually do have one more, Chinchilla Jonesia.
Yes, she can go.
Okay. Chinchilla Jonesia, if you are on, you can unmute and begin your testimony.
Okay.
Just state your name for the record and you can begin. Ms. Jones, are you ready?
Yes, Jonesia.
You can begin your testimony. If you are listening to the hearing in the background, I would recommend muting it because it will cause...
I muted it.
Oh, perfect. So you can go ahead and begin.
Yes, good afternoon, everyone. My name is Chinchilla Jonesia. I'm with Right to Roam Coalition. I'm also a reporter for News Forum and for My Test TV and Philly Cam Voices. I am calling because I have a grave concern regarding the inmates that are elderly, the sickly, those with immunocompromised diseases and things like that, those with underlying conditions. I feel as though that they should be released. They should be granted a reprieve. They should be let out because if they were to become ill from the coronavirus, if they contract that virus, the likelihood of their survival is very low, especially those that are elderly and the immunocompromised. If they're not let out, they get the virus, they will more than likely succumb to the virus. So I feel as though they should be let out, and those also with nonviolent crimes that are behind bars right now. But the thing is, you know, with them being let out, if they're given a monitor and ankle braces to put on and given restrictions and then put back in jail once we're over this pandemic. But for them to sit behind bars and suffer right now with family members so stressed out and worried about them, I really don't think it's fair to those inmates as well as their families because of the conditions that they're living in behind those bars. And yesterday on my news forum, this is the very topic that we covered the whole night. And I heard from so many families that called into the show with concerns about their loved ones. One lady has a husband that's been behind bars for a number of years, and he is immunocompromised. And a few others called in with elderly family members who were behind bars, and, you know, they're suffering from heart disease and some with diabetes and different things like that, respiratory problems. And they're saying that they're still hearing that they have no PPE there in certain prisons, that there's nothing there for these inmates. And with the 23-and-1, that's even harder because there's no place for them to physical distance themselves. And, I think that it should be considered to release those prisoners that, I just mentioned, the elderly, the sickly, those with underlying conditions, and the immunocompromised, and some of the nonviolent offenders. And that is my testimony. Thank you so much. And I thank Councilman Johnson and Councilwoman Batts for putting this forum together, this hearing today on these issues. And thank you again for giving me this time to speak.
You're welcome, and thank you for taking time out of your schedule. Is there any other individuals here for public comment? Any other questions from members of the committee? Okay, hearing none, I just have one last question. I guess, Deputy Commissioner Terrence, are you still available?
I am, Councilman.
Yeah, just a quick question, just for clarity on some information that I'm going over. Is the city, via Corazon personnel, will they administer one-time rapid COVID-19 testing of correctional officers? Are you familiar with that?
Yes, the court order is, well, as of right now, it's my understanding that the one-time rapid testing is for all staff that enters the prison. Not just correctional officers, the contracted staff as well, maintenance, everybody.
Good. Okay.
And
that starts tomorrow?
That's my understanding. Now, I've been on this call all day. I normally would be right in the middle of that, making sure that everything is set up properly for that.
Okay.
But yes, it's my understanding that it's supposed to start tomorrow.
All right. Thank you very much.
Can I say a couple things? I know we at the end.
Sure.
Okay. I just want to say for the record, we at the prisons, we understand everybody's anxiety and fears concerning COVID and concerns. But there's a couple things that I think was misrepresented. First of all, we don't have a basement at the detention center. We house no one in any basement area. We have no control over our census. So the decisions we make are based on our available space. When the female population was moved from Riverside, it was because we needed the space. It was the best use of the space available, sir. We had 200 women taking up a 768-bed facility while we had about 500 and some individuals that was in dormitory-style housing. So we didn't eliminate dormitory-style housing completely. However, we drastically reduced it. And as far as vermin and pest control, all of our buildings are under contract and they're serviced a couple times a week. So we, like I say, we understand people's concerns, but what people also need to realize is this. As we put additional restrictions in place to mitigate the spread of COVID, nobody likes to be restricted. So when you restrict individuals more than what they are used to being restricted, they complain more. Now, and every complaint we investigate, whether it's from staff, whether it's from inmates, we investigate all our complaints. When people call from the outside, we investigate those complaints. And that's how I know that the complaints rise when we go into a more restricted mode around here, because we get the phone calls. And the last thing I want to say in defense of the commissioner, when Sergeant Robinson said the commissioner uses the term staff, it's because unlike those other departments he referenced, she has more than just officers under her supervision. She has social workers, she has maintenance people, she has staff that she's responsible for. So it's not that we don't care about our officers. We care about all our staff. We care about everybody that we have in custody as well. And I'm sorry, I didn't mean to take up a lot of your time, but I needed to kind of address some of them things because there was just a lot of what I can say mischaracterizations today.
Well, thank you for your clarification. Thank you for providing additional information as well. And Commissioner, as always, it's good to see you. Thank you for taking time out of your schedule and being on this call for us. I think we started at 10. It's 3 o'clock. And so for any follow-up, Commissioner, as always, we'll reach out to you. Never have a problem having access to you. And to everybody else that participated in this hearing today, thank you very much. And I believe we all going to get through it. I mean, this is an unprecedented time that any of us have ever been in. Rather you're a correction officer, rather you're a police officer, even us as elected officials, and most importantly as human beings, we've never been here before. And so I expect attention, but I expect us also to come out of this stronger than we have going into it. And so thank you, everyone. And this concludes the special joint hearing on public safety and public health on COVID-19 in the Philadelphia prison systems. God bless everyone.
God bless.
Thank you, Deb.
Recess until the call of the chair.